Good evening, everyone, and welcome to the November 23rd regular session of the Hillsborough Township Board of Education. We are at Otten Road meeting. May I have a roll call, please, Mr. Mahmood?
Early, Mr. Gillette.
Here.
Mrs. Haas. Dr. Harris. Mrs. Maroon.
Here.
Oliver.
Here.
Mr. Pulsifer.
Here.
Mrs. Stats.
Here.
Mr. Trujillo.
Here.
And Dr. Susan.
Here.
We have a quorum.
Thank you. In accordance with the State Sunshine Law of New Jersey, adequate notice of this meeting of the Hillsborough Township Board of Education was provided on November 19th to the Hillsborough Beacon and the Courier News. Can everybody stand for the Pledge of Allegiance? To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Correspondence is as listed. Are somebody's headphones not plugged in? I'm getting echoing. Can I have a motion we have two sets of minutes to approve. The first is the executive session from November 9th. Can I have a motion to approve the executive session minutes?
So moved.
Thank you, Mrs. Haas. Do I have a second?
Second.
Thank you, Mrs. Maroon. All in favor?
Aye.
Anyone opposed? Anyone abstaining?
Abstain.
Thank you, Mr. Gillette.
Motion passes.
Great, thank you. Then we have the regular session meeting minutes to approve from the same evening, November 9th. Do I have a motion to approve the minutes?
So moved. Second.
Thank you. All in favor?
Aye.
Anyone opposed? Anyone abstaining?
Abstain.
Thank you, Mr. Gillette.
Motion passes.
Okay, Superintendent's report, Dr. Antunes.
Thank you, Dr. Sasan. We have quite a few things this evening, and I'd like to start quickly with one thing, and then we'll bring it back to others, and then bring it back to me, if that's okay. As a follow-up to my communication sent on November 20th, I would like to reiterate to the community that in consultation with the district school physician and the Hillsborough Township Health Department, the district initiated our full-day virtual model of instruction started today and is expected through at least December 4th. It is important to note that conversations with Dr. Mandelbaum took place the week before last, as have calls with the township a week ago, Tuesday and Friday, with zero plans to move to remote learning. Additionally, let me get my notes here. Thursday came and the COVID activity report from the New Jersey Department of Health came out Thursday afternoon, indicating our region became orange, which means it's in the high zone. We spoke with Dr. Radwan, who oversees the school nurses who are doing much of the contact tracing for our schools, and Dr. Mandelbaum Thursday night. Friday morning was a busy morning. We met with the administrators, both building-based administrators and district supervisors. We spoke with Mr. Goodhue as the HEA president. We spoke with the board. We sent a communication out to the staff, and finally the community. Considerations to return include the COVID report on December 3rd that will come out, as well as recommendations from our Dr. Radwan, who oversees the nurses, for the overall population, as well as our special ed concerns for consideration, and bringing back our most at-risk students. While we have no evidence of school-based transmission at this time, the new regional data released in the weekly COVID-19 activity level report by the New Jersey Department of Health determined that our region, we are in the Central West region, is now at a high activity rate for COVID-19. The Department of Health suggests that districts should consider implementing fully remote learning if a region is an area of high activity. While I understand that virtual learning is not ideal in many ways, we are obligated to make decisions on what is best for our overall community. We will reevaluate data from the COVID-19 activity level report expected to be released on Thursday, December 3rd, for guidance on reopening on Monday, December 7th. As a reminder, should you have any questions or concerns, please contact your building principal or school nurse. Now, I do have more in my report, Dr. Sasan, but I do know that we have Dr. Mandelbaum available to answer questions from board members if board members have questions for him. So this is probably a good time for that to happen.
Good evening, everyone.
Good evening, Dr. Mandelbaum.
Thank you for joining us, Dr. Mandelbaum. Does anybody have any questions for Dr. Mandelbaum? Okay, why don't I start? So Dr. Mandelbaum, based on the, you're seeing a lot of cases now in the hospital, correct?
In the community, so in outpatient practice and in the hospital. Yeah, hospital census went in the last 3 weeks from almost 0 in the single digits up to we're about 40 as of today at Princeton.
Okay, and with a change from low or moderate to high, various puzzle pieces start falling apart with regard to enabling us to keep the schools open. We discussed this with you on Friday morning after we went into high. And so one of the key pieces was that the change in excluding contacts of contacts and extending that from students, which we had already discussed with you, I think earlier that week or later the previous week, excluding contacts of contacts where students were concerned because they could move to virtual. But when we move to high, we have to exclude that for both students and staff. Is that correct?
Yeah, that is correct. The state actually released new guidelines yesterday or 2 days ago, specifically stating that siblings of suspected cases not have to be excluded, not just probable or confirmed cases, but that was the measurable difference, is that when we switched from a moderate level of activity into a high level of activity, the state's guidelines are that basically to assume as the prevalence of disease is high, anyone who's sick might more probably has COVID. And so to exclude both faculty and students if someone in their house is sick. So the expectation is there's going to be there will be more faculty that you'll have to quarantine.
Okay. Any questions from the board? So as I understand it, Mrs. Trujillo.
Well, actually, can I defer to Mr. Gillette while I formulate my question?
Absolutely. Mr. Gillette?
Yes, so hi. Thank you, Doctor, for being with us tonight. So we haven't seen statistically any spread in our school district, within the school district, at schools. So are we sure that in-person instruction of students is not acting as a barrier to spread?
So you're totally right. I think there is what we have seen so far across the country, but more specifically in New Jersey, has been few in-person, very little in-person spread. Very little doesn't mean none. So the state tracks it, and it's an imperfect tracking, but there's about 55 or 56 outbreaks as of today that they track to say have occurred in school. Right now, my read all along has been school is important. In-person school is important, and in-person school has been safe. The issues, so that hasn't changed. Those numbers do change, or they become harder. The mitigation strategies are imperfect, and so as the prevalence increases, the more likely it is that things will slip through. So I worry a little bit about that when we're in a really high risk scenario, but I don't think any of these decisions are based on because we worry about in-person schools spread. I think the worry is, whether or not that schools can maintain functioning given the need to include both students and faculty. But I'm not worried about in-school spread so much. I also, to answer your question, the opposite way, I'm not worried about in school. The hybrid model has kept them in school, but not all that much. It's not like we're going to release them and they'll not be in school and they're going to then do other things. They might, but if they were going to do that, I would imagine they would be doing that regardless.
All right, can I follow up?
Yeah, please.
Dr. Swiston? Okay. So do you know what percentage, children age 5 to 17 years old, do you know what percentage of the overall cases that age group makes up in New Jersey?
It's a moving target. So what we've generally said is that kids are making up somewhere between 10 to 20% of the cases. One of the problems with any of these numbers is that it is kids are less symptomatic. So they could be, anyone can be asymptomatic, but they have more milder symptoms. And there's a lot less testing for kids. As of within the last few weeks, CHOP would not test a child unless they were sick enough to get hospitalized or was pre-surgical, different than adults. And even in the COVID testing centers in New Jersey, most of them had age restrictions. So
okay. All right, because I was just looking at some charts saying that New Jersey reports it as since the beginning of the pandemic as age group 5 to 17 as 5.5% of all cases.
Yeah.
Been and in most of the spring and summer, that number was below 3%.
Yeah.
Only recently has it gone up. I suspect that's because, as you're saying now, in the most recent window, that age group is making up 10 to 20% of the most recent cases. That's why their percentage overall has gone from 2.5 to 5.5. So that would tell me that the virus is spreading among that age group more prevalently now than it did before. Do you know how many deaths have occurred children 5 to 17 in New Jersey?
I don't think any. Thankfully.
Okay.
Yeah, that has not been the issue. We have, and even the concerns about the multi-system inflammatory syndrome in children. We haven't yet seen a lot of that. It's been thankfully a paucity of cases. So the kids have not gotten very sick. We did have a call with Children's Hospital in New Brunswick and their ICU team last week, and they're very worried about the next 3 weeks, about what they expect to happen, but we haven't yet seen anything. That's it, and that is a after impact from the disease.
What can you tell us about asymptomatic spread? Because I know that China has more, for better or worse, more experience with the virus than any other nation, I would assume, since they had it 3 months before everyone else. I read a study that came out, I think, at the middle of last week about asymptomatic spread, a good study, and it said that, as we know, for most, respiratory viruses, the conclusion was that there is no asymptomatic spread in the COVID-19. Is that your conclusion also?
I think I'll tell you what, what typically what the CDC says is they'll quote somewhere around 40% of disease is spread asymptomatic. The wording sometimes gets tricky. People will interchange asymptomatic just means someone without symptoms. That's a big umbrella because that could include people who never develop symptoms, people who develop symptoms that are mild and don't recognize it. And then there is this period of time that they call pre-symptomatic, the 2-ish days or so before you develop symptoms, you ultimately develop symptoms, but you were shedding the virus beforehand. And that is generally thought to be the case. And we have, what do I believe? I believe it's true. Anecdotally, my practice, we probably have about 100 kids so far, and our numbers, just to talk in the community, we serve a large patient population. We have over 100 confirmed positive COVID cases, and it's been rising every week. So I think last week we had 30 positive COVID cases, which is the most we've had.
Okay, I don't think that really answers, but that's all I have. Thank you.
Mrs. Trujillo, are you ready?
Hi. So my question is, during the summer, Dr. Mandelbaum, when you gave your presentation, and I may have the numbers off, but I thought you said something about we would consider closing schools if there was 5 cases in 100,000. I'm not sure if I have that correct. So there was a community member who was sharing data about Hillsborough's spread with numbers that were, and I forget, can you help me, Dr. Swasan, with the numbers specifically? But I believe that she was saying, just based on what the health department was presenting, that we were above the 5 per 100,000 cases, or?
We are back in September, we were, yes.
So what is but I thought that the recommendation was to close schools at that point, or am I mistaken?
I could walk you through that.
Sure,
So,
that would be great.
yeah, for sure. So here was the concept. As we closed schools in, late spring last year, and then they stayed closed, they didn't know when to open them. So over the summer, the prevalence really fell to almost no disease, which was great. So we really thought we could open, and everyone was very concerned about would schools increase the spread. So they tried to figure out what data points they could use to figure out when would it be safe and when wouldn't? Because if you're waiting for no disease, it wasn't going to happen. So they looked at a couple of different numbers, the 2 numbers that they were throwing around, and they being the state, the CDC, the Children's Hospital of Philadelphia, but anyone who was kind of weighing in, were basically looking at 2 numbers. One is the number of cases per 100,000, and the other one was the percent positivity. And thinking that as those numbers rose, the concept that they were right on the money about is the worry that the higher the prevalence, the more likely it is that things won't work, and the lower the prevalence, the better every plan you have is going to look. So they were choosing data points, and they were using under 5 per 100,000 as we're in a low risk, and over 10 per 100,000 starts to get you into high. As those numbers, as time has went on, so right now, our data from New Jersey is using, we are now over 25 per 100,000 cases. So that's trying to look at population. Those numbers are not perfect, again, just to go back, because you couldn't get tested. It was very difficult to get tested back in the spring. So the only people who were getting tested were people who were symptomatic, and they were extrapolating numbers. It's much easier to get a test, though it's getting a little harder right now. So the numbers aren't really an apples to apples comparison, but we've definitely superseded what those numbers were. But those numbers were a guess. The other thing is, like Mr. Gillette pointed out, we have seen very little spread. So they worried about the spread, yet probably the best counterpoint to closing at some point is the fact that we haven't seen much spread in school. So, we're balancing what we've seen in September, October, since we've been open. The numbers are rising. These mitigation strategies have been very successful, not perfect. And the question of how successful they'll be if the numbers get higher. Does that help?
Yes, it does. Thank you very much. So as a follow-on, when you had said that you're seeing increased numbers of COVID cases in your practice, both your private practice and at the hospital, are you seeing any change in the severity of cases? So
for kids, no. So the severity of cases, and I'm sorry, I didn't, if you want to finish your question.
Well, I was thinking just in terms of, I know you're a pediatric practice, so I was wondering at the hospital, the adult population that you see in the spring versus now, if there is any difference in how they're presenting, how serious. I know in the spring, there's a lot of talk about ventilators. I don't know if in New Jersey, in this region of New Jersey, and I know that there are, I guess, improved methods of handling these cases. But I'm just wondering the severity of the cases that you're seeing.
So I am a pediatrician, but I do serve on the hospital's COVID leadership team. And the answer is the severity of disease so far, thankfully, has been less. And there's a handful of reasons why we think that is. And we don't know what that will mean moving forward. So the first thing is that in the spring, it hit us early and hard and went through nursing homes. So there was a age distribution. So we know that the people at the extremes of age, especially the elderly, were more at risk. And what we have seen up through now has been much more skewed population of kind of whether it's adolescents, young adults, into the kind of middle age, but the nursing homes did a much better job. And then there are both medicines that we've done and kind of management strategies that we've employed. And the combination of all of that, we have seen less ICU and less ventilator dependent issues, and thankfully a lot less deaths. The worry, the palpable worry from the hospital leadership team is what's to come. So we know that the hospitalizations and deaths lag behind the infections by 2 to 4 weeks. So we've been up through now really great. People were very worried about the next month, hoping that those numbers stay the course and that we don't see, despite all these mitigation strategies, an increase in ICU patients and/or deaths. But so far, so good.
So then on December 4th, when the next data, or December 3rd, when the next data comes out, what would you be looking for in order to recommend schools reopen? Would it just be to go back to the medium risk category?
Yeah, and I'll be, so my recommendation is not to close or not to close at all. It's, we're looking at the data. I think schools have been safe. I think the strategies about closing are really administrations, and multiple administrations are making decisions. The decisions differ a little bit. The recommendations are all the same. Numbers are going higher. You have to be really careful right now. Because we're in a high risk environment, so the state will release weekly data every Thursday. It will release their weekly kind of COVID activity level report. As long as we're in the high risk criteria, the strategies that they say you have to do for staff, for faculty, really means that we're going to put faculty, we're going to have a lot of quarantining of faculty, and potentially that will then impede the ability to educate in person. I think that is compounded by the fact that there is the holidays, and we know there's going to be gatherings and a lot of travel. So my hope is that people are reasonable, do what they need to kind of keep the illness low, and that what we need to do is ideally fall out of the high risk. But I think we could stay open in a high risk category if there's not all the other issues that are impacting the difficulty to keep school open. So I don't think it is riskier to be open in a high risk category. I think the combination of the holidays coming up and the travel, and the fact that we haven't yet plateaued, that we're just peaking, I think it's probably good measure to stay virtual for a week. And that's what I would be looking for, is to see where we are, what are our numbers. And ideally, if we fall out of high risk into a moderate category, I think the school should be open.
Any other follow-up?
Thank you.
Drew? Okay. Are there anybody else? I don't see any other questions present. Mrs. Haas or Mrs. Harris or Dr. Harris? No? Okay. Then I'll just add something to what Dr. Mandelbaum said. So my daughter is a pediatric ICU nurse, and this week she had 2 patients who one had the MIS-C, and then one had post-COVID complications. Now they both had previous health issues, but one actually was sent on hospice as a result of the COVID issues. But there was concern about misrepresentation of how that death would be classified. It was a cancer patient, and they were responding very well, but now they would likely classify her death as cancer, is what my daughter was told, not due to COVID complications. So I don't know if that is an issue that you've dealt with, Dr. Mandelbaum, but I think that this disease is hurting the people who are most susceptible, and that we may be underestimating the numbers of deaths. We certainly know that in the scientific community, we're watching very closely just the normal number of deaths in any given year, and the difference that COVID the actual 275,000 this year doesn't even come close to covering the additional numbers of deaths. So whether people are dying of actual COVID symptoms or other things due to COVID, whether it's economic issues or mental health issues or things like that, this is obviously a devastating disease for our community. Okay, if I see nothing else, Dr. Mandelbaum, I'll thank you very much for joining us this evening. You were incredibly helpful. And hopefully we get back into moderate, everybody does what they're supposed to do, and we can reopen in December.
That is my hope. Stay safe and happy Thanksgiving, everyone.
Thanks, you too. Okay, Dr. Antunes, do you want to continue with Superintendent's report, please?
Yes. With the closure of schools to an all virtual model through December 4th, we will continue to distribute meals to all families. Distribution will occur at the main entrance of Hillsborough High School as follows. All virtual students will continue to pick up meals on Wednesdays from 1 p.m. to 2 p.m. Hybrid students can pick up meals tomorrow, 11/24, from 10 a.m. to 12 noon. During the week of November 30th through December 4th, meals can be picked up Tuesday, 12/1, and Thursday, 12/3, from 10 a.m. to noon. To have meals ready for pickup, please email Mrs. Kathy Major DiGregorio at kmajor@htps.us and provide her with how many children are in your household and if you need vegetarian meals. That information did go out in a school messenger. It's not too late to submit a red ribbon anti-drug message poster. Simply design a poster with the theme, be happy, be brave, be drug-free. Be sure to include your name, address, home phone number, grade, school, and teacher's name, and mail or drop off your poster in the Life Skills Coordinator's office in the Township Municipal Complex by Monday, November 30th. The Hillsborough High School National Honor Society members will be hosting story time for elementary school students. The sessions are being offered on different dates for different grades. If you do not have information sent in the school messenger this week, please contact National Honor Society advisors, Mrs. Dana Richens at richens@htps.us or Ms. at htps.us. I have the pleasure of Dr. Feltry and Mr. Arnold of attending our marching band demonstration.
Lisa, is anybody hearing her? Okay, you're popping in and out, so maybe just take a breath and try again.
Okay. I had the pleasure, along with Dr. Feltry and Mr. Ireland, of attending a marching band demonstration for families and friends on Saturday, November 14th. Although marching band festivals were not able to take place this year, the Hillsborough High School Marching Band's program titled 2020, A Year Like No Other, was outstanding. The excitement from those in the stands was palpable and very exciting. As we begin developing the 2021-2022 budget, each year we ask for input from stakeholders at board meetings and also on our website. Please visit the homepage of the district website, www.htps.us, and under What's New, click on Input on the 2021-2022 school budget. Congratulations to Karithi Ovaya Arun Kumar, a fourth grader at Sunnymead Elementary School, who was a second place winner in the 9 to 10-year-old age group of the Somerset County Diversity Festival poster contest. 6 winners were chosen out of 50 submissions. Students were challenged to create artwork that showcased the county's multicultural communities and traditions by incorporating this year's Diversity Festival theme, Somerset County, Everyone Belongs Here. Terrific work, Karithi. I have been asked to share with the community that through a statewide partnership with NJ Hope and Healing, Catholic Charities of New Jersey is providing crisis counseling to those impacted by the COVID-19 pandemic. If you or anyone you know needs to speak with someone, please call 732-204-6510. Again, that number is 732-204-6510. As COVID numbers continue to rise.
Start again.
As COVID numbers continue to rise to unprecedented levels. We're having a problem. Okay.
Sorry, everyone at home, we're having a bit of technical difficulty with Dr. Antunes' microphone, so.
Talk. Is that better?
I can hear you now.
Can you hear me now?
Mhm.
Okay. Can hear me now. Okay. I apologize. As COVID numbers continue to rise to unprecedented levels, so do people's fear, impatience, and intolerance. I think it is safe to say that everyone is tired. Tired of the pandemic, tired of wearing masks, tired of not being able to do what you want to do when you want to do it. Tired of not being able to shake a hand or give a hug.
You phased out again.
Tired of fear and uncertainty.
It's really muffled.
It's the mask.
Well, that worked. So try it again. Go ahead.
Tired of the fear and the uncertainty. Just tired of it all. There may be feelings of anxiety about Thanksgiving and the entire holiday season. Please remember that the safest way to celebrate Thanksgiving, according to the CDC, is to celebrate at home with the people with whom you live. Please remain vigilant but sensible in your approach to dealing with this pandemic. In the midst of everything taking place in the world, the state, and in the community, I remain grateful for many things. And one of them is to be serving the community of Hillsborough. So my wishes for a happy Thanksgiving to the entire community.
So we didn't hear the last bit, but the last two sentences was
the last two sentences. Please remember that the safest way to celebrate Thanksgiving according to the CDC is to celebrate at home with the people with whom you live. Please remain vigilant but sensible in your approach to dealing with this pandemic. In the midst of everything taking place in the world, the state, and in the community, I remain grateful for many things, and one of them is to be serving the community of Hillsborough. Good wishes for a happy Thanksgiving to all.
great. Thank you. So those were the last two
Yes.
sentences. Thank you.
Dr. Swasan, as part of the superintendent's report, Dr. Feltry does have a student performance results presentation, and Ms. Smedley has a school safety data. So Dr. Feltry can.
Okay, Dr. Feltry, are you with us?
I am sharing my screen. There we go. So every fall, the state requires districts to present student performance results from the prior year's school state assessments. And as the state assessments were suspended for the spring of 2020, the state has adjusted their requirements. And so I will be presenting student performance on local assessments that we gave this fall. Earlier in the fall, we administered Linkit benchmark assessments in ELA and math. These benchmarks are aligned to the grade level standards and designed to assess how well the students are making progress towards meeting this year's grade level standards in ELA and math. Since we are pressed for time, we are using the data from these assessments to pace and focus instruction on the skills and content where there are gaps and where there is the greatest need for mastery. We did not test the end of the year because we're not teaching last year's standards. We're teaching this year's standards, and for the teachers to be able to know where to start from and how to get the students to grow, we're assessing them. This is the first benchmark. We will assess them again in January and then again in spring to note their progress. So what I'm presenting tonight is just where the students are beginning. So while the data will look as if our students are performing low, they're not performing low because it's where they're starting and where we need to get them to. So, Tonight, I will be presenting the overall performance of the students, but the teachers are looking at specific data for the students in their classroom. Teachers are looking at student performance by standard, by topic and skill in order to adjust their pacing, to differentiate instruction, and for focusing on the areas where students need the greatest growth. Since this is the first time that the students have taken a benchmark, the data is helping the teachers provide more targeted and focused instruction. Students in grades 1 through 11 were given the Linkit ELA benchmark at the end of September. These graphs show the performance of the students on the ELA benchmark per grade level 1 through 8, and then the other graph is the English courses at the high school. Since we had roughly 50% of the students testing at home, the scores are most likely slightly inflated, especially at the youngest grades, but teachers have followed up with classroom assessments to tease out what the students truly know to be sure we are properly addressing the standards. As I stated before, these assessments measure student performance towards meeting the standards to be learned by the end of the grade level. We do not expect the students to score in the 80s and 90s at this time like we would if these assessments were administered in the spring. These graphs show student performance based on gender. We are happy to see that there's no difference in performance in ELA based on gender. These graphs show grades 1 through 8 student performance based on race and free and reduced lunch status. As can be seen in the data, there was not great disparity between any of the racial groups, but our students who are on free and reduced lunch will need targeted instruction to bridge the gaps seen in this first benchmark. These graphs show high school student performance based on race and free and reduced lunch status. Again, as can be seen in the data, there was not great disparity between any of the racial groups, but our students who are on free and reduced lunch will need targeted instruction to bridge the gap seen in this first benchmark. These graphs show grades 1 through 8 student performance based on special ed status compared to district status. The data reveal that the special ed students have more growth to meet the standards than the district scores, but they are not far behind. These graphs show high school student performance based on special education status compared to district status. Again, the data reveal that the special ed students have more growth to meet the standards than the district scores, but that they are not far behind. Students in grades 1 through Algebra 2 were given the Linkit math benchmark at the beginning of October. These graphs show the performance of the students on the math benchmark per grade level 1 through 8 and Algebra 1, Geometry, and Algebra 2 courses at the middle and high school. Since we had roughly 50% of the students testing from home, the scores are most likely inflated, especially at the younger grades, but teachers have followed up with classroom assessments to tease out what the students truly know and to be sure that we are properly addressing the standards that need to be met. Students did not perform as well in math as they did in ELA. As I stated before, these assessments measure student performance towards meeting the standards to be learned by the end of the grade year, so we don't expect the students' scores to be in the 80s and 90s as we would if they were taken in the spring. These graphs show student performance in mathematics based on gender. Again, we are happy to see that there's no difference in performance based on gender. These graphs show grades 1 through 8 students' performance based on race and free and reduced lunch in the mathematics. As can be seen in the data, there was a greater difference between math performance among the racial groups than in ELA. And again, our students who are on free and reduced lunch will need targeted instruction to bridge all of the gaps seen in this first benchmark. These graphs show Algebra 1, Geometry, and Algebra 2 student performance based on race and free and reduced lunch status. Again, as can be seen in the data, there was not great disparity between any of the racial groups, but our students who are on free and reduced lunch will need targeted instruction to bridge the gaps seen in this first benchmark. These graphs show grades 1 through 8 student performance in math based on special ed status compared to district status. The data reveal that the special ed students have slightly more growth to meet the standards than the district scores, but that they are not far behind. And these graphs show Algebra 1, Geometry, and Algebra 2 student performance based on special education status compared to district status. The data reveal that the special ed students have more growth to meet the standards than the district scores, but that they are not far behind. Questions?
Thank you, Dr. Feltry. Does anybody have any questions? Mrs. Trujillo.
So my question is, when I was reading the education minutes, that the tests that were administered appear to, the minutes refer to sixth grade as an example, and that sixth graders were given the test that they would get at the end of sixth grade. And so then I suppose that when you see 50%, that I understand that that's at the beginning of the school year, so that they have not covered that material. My question is first of all, is that best practice? Second of all, it just seems strange to me, because if a student is presented or asked questions that they would not necessarily know until the end of sixth grade, does that skew data? Because they may look at the question and go, oh my gosh, I don't even know anything. And that was surprising to me. I would have expected that the test would look at the end of fifth grade and then use that as a benchmark to see what they learned. Does that make sense? Because I'm kind of thinking when I was in school, I used to look at the back of the textbook and I go, oh my gosh, how am I ever going to learn all this? And so that if they were to give me a test in September for something that I was expected to learn over the course of the year, I don't know that I would be able to answer those questions, and might get me a big zero.
Right. And you can consider this benchmark like a pre-assessment, and it is best practice to assess what they did or did not learn at the end of the grade level before, when you know that you're not going to actually be addressing those standards, gives you information that you can't act on. But in this case, this benchmark as a pre-assessment gives us information of, okay, here's where we need to start. Because obviously our students know a significant amount of information. Why spend time on what they already know and have mastered? Let's focus on what they don't know and what need to master, because we know we're limited for time, especially with the state of the pandemic and where we are with instructional time. So that's the whole goal. But these benchmarks are designed that way. They're also a measure of trying to predict student performance. Some districts use them for this, predict student performance on the state assessments, because they are aligned to standards. But for our purposes, we're using them mostly as a pre-assessment in order to focus and target our instruction to maximize our time as best as we can.
Thank you. So my follow-up question is, what was shown as the average across grade levels, did you see significant spread around the average?
Depended on the grade level, but most of the grade levels, and I have that data for you that I can always share with you. I mean, as you would expect, you have students who are performing at the low levels from anywhere from, most of the time it started at 10% or 20% of the content was known, all the way up to 80, 90. Every once in a while you had 100%.
100%. I mean, that's impressive. So is that something that administration is looking at in terms of, well, those kids ought to be pulled out maybe and pushed ahead?
It will depend on whether or not they were virtual or hybrid, where the test was taken. We do know that this was a low stakes assessment, in the sense that we didn't have a secure testing environment. So we have to be careful about taking the data and saying students need to be accelerated or students are behind. We need to be really, really careful with that. And that's why teachers are following up with instruction as well, with their own classroom assessments, to kind of tease out how accurate this data is. This is a starting place to help focus where we spend the majority of our time.
Thank you.
Yeah.
Anyone else have any questions for Dr. Feltry? Mrs. Stats.
Thank you for your presentation, Dr. Feltry. I'm not sure if this is the appropriate time, but I was wondering if you could explain how we are addressing the needs of our special needs students. What kind of special efforts are being made by all staff members in dealing with what they need to succeed?
Well, I mean, based on the data or just
Well,
in
well,
general?
that's why I wasn't. I guess in general. I mean, I wasn't sure when to bring it up, but since the special ed data was part of your presentation, I thought I would just use this opportunity.
Sure. Well, I mean, my understanding is we have our special ed students coming in more often. Well, it depends on which, I'm not sure which special ed students you're talking about, but our students with IEPs who are in our general education classes, they have, if their IEP says that they have a special ed teacher as a co-teaching model, then they are accommodating and making the appropriate accommodations as per their IEP, as well as looking at this data. If we're going to talk about ELA and math, the teachers have the ability to drill down to the student. They have the ability to group the students based on which standard, which topic, which skill they know and don't know, so that they can target instruction. So it's not only our special ed students, but our general ed students who will have more focused instruction, but that's how they're using this data for that. I'm not sure that we're doing anything more special than we would be doing in any typical year in terms of meeting the needs of our special ed students. I really feel that we do a really good job in terms of meeting their needs. So I'm not sure exactly what you're looking for.
Well, I guess you know, I'm sure we, even during the hybrid time, that we did have special ed students that were whose parents chose that they were virtual students. And of course now everybody's virtual. Are there any ways that they're being that their needs are being addressed in these special circumstances? I have heard anecdotally that not just teachers, but like CST and guidance counselors are really trying to go out of their way to help everyone, but, you know, especially our special needs students. So I was wondering if you could expand on that.
I'm not sure that I can directly, but I again, anecdotally, I know only what I'm hearing from the supervisors of special services. The CST members are reaching out, the counselors are reaching out on a regular basis, the teachers are reaching out on a regular basis. Often you have two teachers or you have instructional aides that are reaching out to the students. And I do know our office hours are being utilized to their maximum, is my understanding, with small group and one-on-one instruction for any student who needs it, but especially for the students who want that one-on-one and extra time with the teacher in order to understand. So that is my understanding, how they're using the office time and where they're getting their maximum benefit or maximum instruction, if you will.
Thank you.
Any other questions from the board? I don't see any. Dr. Feltry, thank you so much for that presentation.
Thank you.
And Dr. Sasan, we have Ms. Smedley, who will do her presentation on the School Safety Data System Report for period 2, January 1, 2020 through June 30, 2020. And she looks like she's ready. Thank you, Ms. Smedley.
I am. So I am presenting the SSDS, so the Total Student Safety Data System Report for our second half, really our second half of the school year. So it's reporting period 2. This is January to June. The majority of these, almost virtually everything, happened prior to the school closure that we see here on the report. Just wanted to point out, so it's interesting how the state chooses to lump these things together. The HIB, or harassment, intimidation, and bullying, confirmed cases go into the same incident total as any other violence, vandalism, substances, or weapons reporting. So we'll see that on here. When I know that in prior meetings, some board members have asked about other incidents leading to removal. So removal can be, it's typically in-school suspension for not attending a Saturday detention in most cases. So that would be something that's not violent, but it's really an application of the code of conduct. So our total harassment, intimidation, and bullying incidents for the second reporting period were 7 as they were reported in the summer, but as the board is and will affirm tonight, we did have a couple cases at the high school that were being cleaned up, and investigations were being re-examined through the summer and the fall as we returned slowly to school. So the report will actually be updated to reflect 3 total HIB alleged incidents for the 1920 second reporting period, with 2 of the 3 being confirmed HIBs. So that we'll just update that now that now that we presented it, and once the board affirms that decision for the second reading tonight, we'll go ahead and update that state report. So other things that I think are worthy of pointing out, we take a look at our trainings and programs. So those are typically faculty meetings when we talk about what's going on. Our school safety team and school climate meetings have gone online, and some of that obviously we see at the middle school that's down to 0. That went down for the second reporting period, but most of the events that we would have had, things like assemblies, prevention programs, anything other than just school climate and safety team meetings were difficult to maintain as we sort of worked through the first few months of the pandemic. So we've reviewed that. Since then, I just wanted to put it on record that we have had all of our administrators and our HIB specialists trained this year specifically on how to conduct investigations or best practices for conducting these investigations online, since we know that our total school population may not be with us for some time. So we wanted to make sure that we did that. So that training happened just a few weeks ago. And I think it was really a pretty rich experience for everyone to be in the same online room together with David Nash from NJPSA, who gave us a lot of good guidance on how to take care of investigating these incidents should they come up as while we still have some students at home. So that's pretty much it, unless any board members have any specific questions that I hopefully can answer.
Thank you, Ms. Smedley. I believe Mrs. Trujillo has a question.
Thank you. Although this report only shows period 2, board members received a document that compared periods 1 and 2. So my question is that there seemed to be an increase for Oughton Road in the column of other incidents leading to removal for period 2 as compared to period 1, which only had 3 cases. And I was curious if you could comment on that.
So I did not, this is on the same spreadsheet. So I just scrolled up to see exactly what you were talking about, Mrs. Trujillo, which is the period 1 that goes from, actually goes from July to December because it splits the year in half. Off the top of my head, because those are non-HIB incidents, it's not something that I know off the top of my head, but what happens with incidents in that column, the state in each of these columns counts incidents and kids differently. So I know that just with the HIB that happened at Oughton Road in period 2, because that's really what I could speak to better, there were multiple offenders. And so that those incidents, because let's say there were 5 or 6 offenders with 1 HIB, that counts as, that's part of what accumulates. That's an unduplicated count of kids on the unduplicated count of incidents. So I would imagine that's probably what it is. I think, if you wanted some more details on that, that would be something for the VPs and the principals at Oughton Road to probably address, because they're non-HIB related.
So you're not aware of any glaring issue at Oughton Road that would be reflected in that? You think that it's just the HIBs? Like multiple students?
I think that for the HIB, specifically the one that they had for the confirmed HIB, there were multiple people. For the other ones, off the top of my head, I don't know specifically, but that could be any other application of the code of conduct. And In most cases, and from my experience over the past few years, it also can be one student having multiple incidents. So it does not necessarily, it doesn't really speak to 18 different students had an incident that rose to this occasion. So when there's multiple, when one student has multiple problems, that repeats itself in that column.
Got it. Thank you.
Anybody else? Okay, seeing none. Thank you, Ms. Smedley.
You're welcome.
Dr. Antunes, do you have more, or are you done? Okay, thank you. Okay, we do have a motion to approve a resolution designated Hillsborough Township Public Schools as stigma-free. Because I don't see a need to do that prior to the board public comment, we'll take that up under the education agenda, or just prior to the education agenda, if that's okay, just in case somebody from the public did want to address that. So the next item would be committee reports then. So can I ask Mrs. Haas to give the education report?
Sure, happy to do so. The Education Committee met on November 10th and had a lengthy agenda as usual. There were 11 additional curricula that we looked at, 5 in mathematics and 6 in social studies. These were basically the last of the tweaks that had to take place for the completion of the math curriculum rewrite and for the social studies department. So we had a good discussion on those curricula, and we veered off into discussing AP classes as well, and how the situation was last year. And we learned that test results have not been shared yet. So hopefully things will go better with AP classes, but we also discussed whether or not there could possibly be more college courses offered, where kids could get direct college credits for a lot of the classes that they're taking. And that will continue to be looked into, especially given the current environment, might be a little bit more difficult. And we also had a little bit of a discussion about how much of a loss of foundational math skills students have experienced due to the school disruption from a normal learning environment. And happily, Kim presented tonight, and thank you very much, Dr. Feltry, for a very, very good report. And I'm very happy to know that everybody's very focused on all of those matters. We also reviewed the nursing services plan, which is on the agenda for later today. We talked a little about our situation with recruiting nurses, and we are going to, as I said, be voting on this later today. We had several policies for consideration in athletic competition, emergency procedures for athletic practices and competitions, gifted and talented students administering an opioid antidote, and a seizure action plan policy. We had previously discussed the gifted and talented students policy based on new law, and the rest of the policies and regulations are based on tweaks in recent legislation. We also did our favorite activity, which is reviewing possible calendar options, and we actually brought it down to a version that we liked based on whether or not we could secure a venue for graduation. And hopefully we'll have more information on that in December. And we reviewed the performance data at length. So I'm very, very happy that I don't have to report any further on that because Dr. Feltry did such a great job. And we talked a little about the stigma-free Somerset County resolution. And we looked at some statistics about marking period 2, may it sort of rest in peace. At the time of our meeting, there had been an increase in hybrid students by about 3%. And that was a total increase of 53 students. And we had further discussions about whether or not to bring back elementary students and special needs students and at-risk students. And there was supposed to be more information coming shortly on that. And we discussed the dance team. Hopefully we now have criteria for them to earn varsity letters. We discussed the PSATs, and we talked about the possibility of offering the PSATs on January 26, 2021. There was an estimate that about 500 to 550 students might be interested in the assessments. Mrs. Feltry, Dr. Feltry, are we proceeding with that at this time?
Yes, we are. Ms. Smedley probably could speak to it more, but yes, we are ready to go.
Okay, great. And we discussed CUSAC a little bit, and happy to report, as in most previous years that we've been studied, that our curriculum is in really great shape. And I thank our assistant superintendents, past and present, for the very good record this district has always had in the area of education. So hopefully one more year, and we'll find out on December 15th. So that's it for education.
Thank you, Mrs. Gillette. Mr. Gillette, can I ask you to do operations, please?
Okay, sure. Operations Committee met on November 11th. We had a massive agenda. I'm running out of adjectives for these 4.5-hour meetings, to tell you the truth. So today's massive. So fortunately, on our massive agenda, one of the first things we discussed is that you see in the minutes is the policies. I think there were 6 or 7 policies and their accompanying regulations. Fortunately, these were all minor language revisions and mandated revisions. So we didn't have a lot of discussion on that. These are just the typical the state changes language on something, so we have to reflect that language in our policies. So there was no actual policy changes. We had our architect, Mr. Wozni, was present, and he gave us an update on all of the referendum projects around the district. So the middle school roof, that's essentially complete. Probably by now it is. This was almost 2 weeks ago. High school roof, essentially complete. All the paving, essentially complete. The tennis and track, essentially complete. The HVAC work in the auditorium was at 12 days ago was substantially complete. I'm hoping that it's essentially fully complete now. We're getting, Mr. Wozni is getting ready to bid out the projects for next summer's work. We're going to get a real good head start on that this year. He's almost ready with the mechanical upgrade package, ready to bid. The building maintenance system work, and he's going to get that going pretty early. Now, bad news. The HES playground. This is the biggest crap show, one of the biggest ones I've seen in years on this board, that this playground's still not ready to go. As you recall from my last report on this saga, there was some perception maybe that the footings were not done to the right depth. Well, that's correct. The footings were not done to the right depth. They dug up a few to see, and it was all done incorrectly. The lesson for us here is that we cannot have any construction projects in our district that don't come through the administration, if not the board also. As great as it is that HSAs and other groups finance and do fundraising and do these projects, it can't go on for years like this because it winds up, we can't leave an unfinished project there. Ultimately, the board The district has to take responsibility for cleaning up the mess, and this has been a big mess. So we didn't spend too much time on that. We had, but in the end, we have to get the architect involved now. And so that's another, and that's, he bills. He bills for the work he's going to have to do on that. So that's that. While Mr. Wozni was still there, we talked about something that I reported a few weeks ago, possibility of doing some work on the HES roof and paving in their parking lots. This is still up in the air. Mr. Wozni is going to investigate a little more about it. We had Lisa Gorub, who's our attorney, and Robbie Akampora, who was our new financial advisor from Phoenix Advisors. They were both on the call with us. They gave us a few different options for financing this. I'm including like a lease purchase, 5-year lease purchase option. But we're not proceeding yet until we know a little more from Mr. Wozni on that. Let's see. We talked a little bit about it, and committee members expressed their concerns about the current construction delays that they went so far into this school year. And we're pleased, committee members were pleased that the work is now being completed. It's essentially complete now, but expressed concerns that next year's projects do not also go into the start of the school year, especially since next year's projects are slated to include the vestibules at the schools, the security vestibules, and the security vestibules cannot go into the start of the school year. If we have regular school, there needs to be a front door. So that's high priority. School won't be secure if it's a construction zone. So Mr. Wozni took that to heart, and he's going to work on that. Let's see. We talked a little bit about all the different projects, including the rest of this, the completion of the other part of the Sunnymead driveway project and all of that. That's all for next year. We had a lengthy discussion about it. Let's see. We had a long discussion about, air quality. We talked about ionization. We had someone come on from Core Mechanical, I believe, to speak with us about not from Core Mechanical, from EI. I'm sorry, thank you, Mr. Moon, from EI, who's our environmental consultant.
EDI.
EDI, right. EI is it, right? EDI, Mr. Groman, right? Tim Groman? Yeah, okay. So he's the environmental expert on this. He does not recommend the ionization system installed in all of the classrooms that Mr. Wozni had floated a few weeks ago. So that's discussions about what to do are still up in the air. Let's put it like that. So we're putting that on hold. It was an expensive project, and it seems to be the consensus, if not unanimous, that that we will need to do some more study before we commit to $500,000 or more on something that might not do what we think it's going to do. We talked about, so I already mentioned that we talked about the funding of the, how we could possibly fund a HES roof and parking lot. It's minutes are kind of out of order here. We talked about some business office personnel issues, which I can't discuss. Not issues, but staffing and positions, and not personnel, I shouldn't say, just the organization of the business office. We talked about whether we should have an additional demography report, and we're not going to do that. We're just going to have demographer revise and complete his initial report, which he said he was going to do when he got the updated numbers. Each May, we appoint our professional services in the operations area. So about every year, we have about 9 or 10 professionals. Every year we do about 3 or 4, have a more intensive review. So coming up for this May will be the auditor, the architect, and the environmental consultant. I'll say the auditor, we're going to have to change auditors because Tim Vrabel, who's been doing this district for well over a decade, maybe over 20 years, he's finally retiring and getting out of town. So we're happy for him. We talked about the treasurer of school monies. We're going to have a different treasurer of school monies. That job might fall to Mrs. Sangiuliano now. She is a CPA and can do that work. Although if another candidate comes along that might be suitable for the job, we would look into getting someone outside of the district. That job is usually taken by another financial professional in public service. In other words, maybe someone who works for the township who has done the job in past years is unavailable to do it going forward. But we'll still have a treasurer. That'll be Mrs. Sangiuliano for the time being. Mr. Mahmood talked about the budget calendar. And say I don't want to leave anything out because my friend over here on my left be angry if I leave things out. We talked about the CUSAC procedures going on with the state taking a look at how our district is run, and that all seems to be going well. And I think that was it. Anything else, details I left out, you can find in the extensive minutes. Thank you.
Thank you, Mr. Gillette. Mr. Pulsifer, can you please give the HR committee report, please?
Certainly. The HR committee met on November 11th also. We began with some information from Mr. Callahan that we have 3 applications for clubs at the high school with advisors acting on a voluntary basis. Those 3 advisors are on tonight's agenda. There was a discussion about how clubs are stipended, and we wanted to make sure people understood that the fact that we have a club that has a volunteer advisor does not in any way mean that that club will become a stipended club in the future. There are limits and controls on how many clubs we have and what are stipended. So while we will approve voluntary advisors for those clubs, that is in no way indication that this will become a stipended club. We had a discussion on policies that are all on tonight for first reading. Policy 1629, it's a procedural changes about how we handle extensions versus new contracts for administrators. And that's mostly cleaning up procedures. Policy 8420, emergency and crisis situations. The updates here were with regards to making sure that our substitute staff are properly trained on handling emergency and crisis situations. The other 2 policies we discussed, policy 3282 and 4282. These are similar policies, one for teaching staff, one for support staff, regarding use of social networking sites. We had an extensive discussion about where this fits and how this could be seen as impacting free speech. We had discussions, and Mr. Lapira, our counsel, was part of the meeting. We discussed that free speech is not limitless, and that there are places that we would need to put constraints on usage of social media and social networking sites. And one important aspect of that is, given that there are limits, we need to have a policy so that if there comes a time where there needs to be an action or a discussion, we have a policy to refer to. So we had a lengthy discussion down that line. We also discussed from something that came over from the Education Committee, the Nursing Services Plan. We discussed what our current rate for nursing substitutes in the district. After discussion and some investigation as to what we are paying and what neighboring districts are paying, there is an item on tonight's agenda to change our daily rate from $200 a day to $225 a day. We also discussed the treasurer monies and thanked Ms. Sangiuliano for filling in that critical role. We had a brief discussion about the possibilities of a virtual school cohort. At this time, that is not something we see as feasible, especially as we were discussing then the potential for issues around the holidays with what we ended up seeing happen with schools going fully virtual. So for now, we're not taking any action on that. And finally, a presentation from Dr. Antunes about CUSAC and our progress towards submission. And that was our meeting. Thank you.
Thank you, Mr. Pulsifer. And very quickly, the Governance Committee met on November 17th. We discussed one two potential bylaws, one that is on the agenda for this evening on board member use of social networks. The other, which was a proposed bylaw on remote public meetings during emergencies, was something that our legal counsel, Mr. Lapira, did not recommend that we adopt at this time, especially given the changing regulations. Instead, on the agenda this evening is a revision of the resolution that we passed in October that referred to public comment and how we run our meetings, and that we will bring up for revision based on the discussion that happened at the end of the October 26th meeting, where we decided that we would split the public comment period into two different periods of 30 minutes each. And so that is on the agenda for this evening. We also reviewed the CUSAC documents as it related to board governance. So that was it. Even though that seemed very short, it was an hour and a half long meeting. So that is the end of committee reports. So we will move to comments from the public and the board. We very much welcome input from the public. During board meetings, there will be two 30-minute periods of time that the meeting will be open for public comment, where members of the public are invited to comment, which they may do via Zoom, in person if they are attending in person, or via written comments sent via letter or email to BOE public comments at hgps.us. During the first public comment period, which is now, members of the public may comment about any item that is listed on tonight's agenda before the board votes. If time remains in this public comment period, members of the public may comment on any school or school district issue that a member of the public feels may be of concern to the residents of the school district, as per bylaw 0167. Before you state your question or comment, you'll be asked to provide your name and address. Please understand that our public forums are not structured as question and answer sessions, but rather are offered as opportunities to share your thoughts with the board. In instances where the board believes that there is a misunderstanding or inaccuracy, the board president or superintendent will address the comment. There may be times when a member of the public makes a comment or asks a question about personnel or hiring decisions. Kindly note that the Open Public Meetings Act and the privacy rights of public employees encompassed therein do not permit the board to discuss personnel issues in public session. So I'll begin with comments on the action agenda with people in the room, and then we will look at the Zoom participants as well. For those of you in the room, you can make a comment from your seat on your own device, or you can come up to the public comment Chromebook, or I guess that isn't a Chromebook, that's actually a PC, where Mr. Handler is, and you can make your comment from there. Does anybody in the room have a comment on the action agenda? Mr. Goodhue. I don't think we're going to have a lot of comment on, so I'm happy to hear it now. If anybody else has something exclusive to the action agenda? No. So please, Mr. Goodhue. Oh, I'm sorry. I thought last time that magically happened, a little elf in the corner did it for me, but this time I'm going to promote you to panelist, and then I will ask you to turn on your video. Where did you go now? Why am I not seeing you in the panelist section? You see him? Did you ask him to turn on his video too? But there you are, Mr. Goodhue.
Sorry.
Thank
Okay,
you.
you're better.
No, appreciate that. Thank you.
Mhm.
Good evening, Henry Goodhue, Hillsborough Education Association. I do want to speak on a few issues that are pertinent to the action agenda. Before doing so, I just do want to take a moment to recognize that last Wednesday was Educational Support Professional Day. It was National ESP Day for the NEA. We were very proud to celebrate the contributions of the hundreds of ESPs that we have the honor of representing in the HEA. So I do appreciate you allowing me the moment to publicly recognize their contributions. I would also like to speak to the social media policy that is posted for today. I understand the need to have a social media policy. I recognize that most organizations have a social media policy, and given the world that we're currently in, the need for one to exist. That being said, I do have concerns about how the current policy is written, whether or not that will infringe upon freedom of speech. And as Mr. Pulsifer noted, freedom of speech is not absolute in certain settings. So I do recognize that. But even with that in mind, I do have concerns about this one. I also do have concerns that the current policy as written could come into conflict with the Workplace Democracy Enhancement Act, which is the law passed by Governor Murphy that protects certain activities that union members engage in. So I do believe that it's important to have some note within any policy that makes reference to the pertinent laws that could possibly supersede the policy. So with that in mind, what I would ask is that if at all possible, this policy, I realize it's first reading, but that this policy be stayed for tonight or moved to a point where we can have further feedback on this and provide some perspective from that of the association to make sure that what is in place doesn't create future conflicts down the road. So I do appreciate that. The other thing that I would like to speak about, not necessarily on the action agenda itself, but it did come up in the conversation between Board Member Stats and Dr. Feltry regarding schedules. I realize that as we move towards different models, whether it be a virtual one until December 4th, with the goal obviously of returning, we're putting another change in place for the students. And I think it's a rather abrupt one, as much as we did make the point of announcing this one. We're asking them to change next week to a different model and then possibly change again when they return back to the hybrid model. And I think that we're putting them, our parents and our teachers, in a bad position. We're creating a lot of disruption there. And I do have great concern about how doing so will negatively impact not only the work that our teachers have put out planning for hybrid models, but also the mental well-being of our students and the needs of our special ed students, because those office hours have become very crucial to these kind of chaotic different times that we're in. Students rely upon them, staff relies upon them, our instructional assistants use them to work very intensely with our special ed students, our counselors use them, our CST members use them. Those hours are very, very important to ensuring the well-being of our students. So I would ask that it be considered that for the time being, I realize that things may change as everything changes currently, but at least for the time being, while we go into the next week with the intent of revisiting this on the 4th, that consideration be given to maintaining the current schedule so that we can keep those extra fail-safes in place for our students during that time. The other piece that I would like to touch upon tonight is we've spoken a lot about collaboration over the last couple of board meetings. I do want to note, as Dr. Antunes said, that we did receive a call to have some questions answered and to field those questions prior to the communication going out. We did appreciate that. I would also like to extend my appreciation to Dr. Antunes and to Michael Callahan, who will be joining our members tomorrow in a town hall meeting. We do appreciate them giving their time to do that, to field some questions from our members related to COVID-19. They'll also be joining representation from the town and from the NJA as well. And we do look forward to that. And I also would like to extend our gratitude to the technology department and to the business office, who very quickly responded as we transitioned to the virtual model to make sure that members had the technology they needed to continue delivering the excellent experiences that they are delivering to our members. And that is it. So thank you very much. I appreciate you giving consideration to the issues that we brought forth today. Oh, and I'm sorry, and I am remiss. I did have one last point. I just wanted to also touch upon consideration being given to possibly continuing collaboration further to discuss whether or not there's ways we can streamline or better serve some of the contact tracing. I do know that that's a major issue everywhere. I imagine that it's one for us as well, whether that's collaboration with the town, with us, however we can do that. I think that contact tracing has become key to all of this. And I do believe that through collaborative efforts, we could find better ways to focus on that effort and better serve all of our community with that. So thank you. And this time I'm really.
Thank you, Mr. Goodhue. I don't know who is, it was fine, but you were 5 minutes in. So I'm just checking on who is timing for me, because if somebody does go on, you hit on a lot of different very good topics. So that's fine. Anyone else on the action agenda? And not even among our attendees. So I guess people may have comments on other items. So we'll switch to other items. Please. Hold on a second. I need to promote you to panelist, which I'm doing now, Mrs. Fenimore. And then once you are there, can you start your video as well? Okay, there you go. Whenever you're ready. I can see you. I can't hear you though, Mrs. Fenimore. Is your headphone working? Is your microphone working? I can't hear you. Perhaps you can just walk up to the Chromebook for us. Sorry about that.
Can you hear me now?
We can, yes, thank you.
Okay. I'm Helen Ann Fenimore. I am not new to Hillsborough school system. My youngest is a freshman at the high school, and in all the years that I've been in Hillsborough 22 years, I've never had to contact the board. I've never had to contact superintendent, principal, anybody on behalf of a policy in the school. I know I only have 3 minutes, so I'm going to cut to it, and it's the academic integrity policy. My daughter's a freshman. She was accused of violating the academic integrity policy because she had taken an assessment in person. She is a hybrid student, was a hybrid student, took an assessment in person on October 13th, received an email from her teacher 2 weeks later saying that she violated the academic integrity policy and she was receiving a 0 on her assessment. My daughter came home upset, wondering what was going on. I contacted the teacher right away by email, and I copied the principal, Mrs. Bingert. Teacher basically got back to me and said she answered a question on her assessment that was not on her assessment. It was on another version of the assessment. So in that case, she must have cheated on that question. All of her other answers on her assessment were correct. I directly went to the board. I sent an email, probably all got it. Dr. Antunes got it. I spoke in person with Dr. Feltry with my daughter in tow. We went and spoke to her in person. My daughter took the test. When I realized she took it in person, I went right back to the teacher and I requested an apology and the test to be graded. And no answer. I did hear back from Mrs. Nur, who said it didn't matter where she took the test. They're still going with for violating the policy of academic integrity. I don't understand this, and I'm sure I'm not alone. And to accuse a child, especially in this environment, they're having a hard enough time as it is, a student who is an otherwise A student, accusing her of cheating without proof, just a suspicion. Suspicion is automatically equal to guilty. Jumping to conclusions. When I spoke to Dr. Feltry, she advised that there's a big issue in the math department with cheating during this virtual environment. You cannot lump every situation into that bucket and say, this student cheated. You're doing damage to the student who is innocent. That's the reason I brought my daughter to the meeting with Dr. Feltry, because I wanted her to meet her and I wanted her to talk to her about it. There's no, is that my 3 minutes? Okay, well, he got 5, so.
You can finish up.
Just give me a couple. It took too long for that test to be graded. The reason my daughter was told that she was presumed to have cheated is because she couldn't give an answer as to how she got that answer to the question. If the test was graded timely, maybe she would have been able to answer it. She's a 14-year-old girl. She got the answer wrong. I think this whole system is a problem. And if the teachers are having an issue with the virtual environment and not being able to trust what the children are doing, then something else has to be done, because you're lumping every child into one bucket, and you're going to fail your students. You really are. Every day my daughter asked, did anybody say anything, Mom? Did you hear anything yet? I said, no. Dr. Feltry got back to me, and then Mrs. Bingert actually emailed me today, and she was going to look into it. I said, well, I'm already going to the meeting, because I think this has to have a broader audience. I think more people have to be aware of what's going on. You can't put every student into the bucket because you're saying, okay, they're cheating, so they get the 0. Can't rush to judgment, and you can't. Oh, and the other thing was, she had a proven knowledge of the material. She got the other questions correct. There was a follow-up exam. She received an A. She knows the material. There's a problem. And she deserves an apology, and she deserves that test graded. And if she doesn't, I did all I can do. So that's my piece.
Thank you, Mrs. Fenimore.
Thank you.
Mrs. Salinger, do you have any statement? Okay. And does anybody on the Zoom call have a statement? If not, I do have an email from earlier today. Let me just find it. So this is from JD Petition Jack Dankers, of an 11th grade student at Hillsborough High School, to the representatives of the Hillsborough Board of Education. There is currently a petition which has nearly 1,200 signatures as of 11:51 p.m. on Sunday, yesterday. The petition reads, as the members of the Board of Education may or may not be aware, there is a petition currently circulating. The purpose of this petition, which has garnered nearly 1,200 signatures as of 11 p.m. Sunday, November 22nd, is to continue the A-Day, B-Day schedule instead of implementing the full-day schedule. There has been a degree of uneasiness over the last few days as a result of the announcement, which states that Hillsborough was shifted from a half-day schedule to a full-day schedule. A significant number of people find problems with this abrupt change, and some of them are listed below. Many see this change as pointless. Number 2, if forces students, parents, and teachers to change their entire lifestyle to cope with this unexpected change. 3, students will be forced to sit and stare at a computer screen for over 6 hours every day, a roughly 50% increase, not mentioning the time they will spend completing homework. Number 4, students and teachers have spent the last 2.5 months adjusting to this new system of learning. Now, once everyone has finally become adjusted, why does the board deem it necessary to make another substantial change, which will throw everyone off course? Number 5, when COVID-19 cases decrease and the Board of Education deems it possible to reinstitute hybrid learning, how will this be achieved? When this happens, the lives of all students, parents, and teachers will be forced to once again quickly readjust to a completely different system. Number 6, the motivation of many students has been significantly lacking, and this change will certainly be a detriment to them, not a benefit. Number 7, teachers who have spent a significant amount of time creating new class plans to better reflect a 70-minute period are now going to be forced once again to completely rethink their approach. So that is from Mr. Dankers. I did get another email just 20 minutes ago. Mr. Mahmood, did the meeting announcement allow for me to read this? I mean, we said that they should get it in by 9 o'clock in the morning, but I don't want to exclude this if I can. Okay. Since we have time and I don't see any other hands raised. Oh, I do have a hand raised? Okay. Well, I'll read this and then I'll address that because then I won't take any new emails via comment via the email. Jordan Lindsay, 16 Oliver Court, and I'm a junior at HHS. Like many people, I was shocked to see the schedule change for only 8 days of online learning. Now I understood this was placed in the Roadback Handbook. However, this was not a major discussion point at the time of the releases. Now I know this extension of the day will not affect most students, but it most certainly have the biggest impact on high school students, specifically students with jobs. I'm going to lay out my daily routine for you so you can get a sense of what it is like for a junior in high school during these times. I get up at 6:30, 5:30 with hybrid, get myself ready for school, attend school from 7:30 to noon, do my homework for the classes I had those days, go to work from 2 to 8 p.m., sometimes 10 on late nights. I go to bed at 10. I even set my alarm to get up at 7 and do more homework over the weekends. It is very rare that you will find a student like me who has a daily organized routine set up without the bounds of school. I never turn on my assignments late and I always get my classwork done, even if it's not for a grade. Now I will give you the rundown of what will happen if you decide to keep this new schedule. I will start school at 7:30 and go to 1:45. Then I will mad dash, sprint out of my house to get to my job on time. Stay till they decide I need to go home, stay up late to finish homework I didn't get a chance to do before going to work. Then if I'm lucky, be asleep by midnight. Then rinse and repeat. One thing to keep in mind here is I am an AP and honors student, so my workload is heavier than most other students. And some people take me laying out my schedule as stress, I will say my existing schedule that I have set up is not stressful. My course load is not stressful. This new schedule change is stressful as I now have to decide what to sacrifice, my grades or my paycheck. Before you say, if this were a normal school, what would you do with your job? If this were a normal school year, I would not have my job. If this were a normal school year, I would not be up here making this speech. If this were a normal school year, then the children would not have to be the adults. Before you come asking me questions, let me ask you some. What was wrong with the pre-existing schedule that was already set up? What about the students that are gonna have to quit their jobs now? What about activities like peer mentoring? What about the students who attend VOTech? Did you consider any of these people before you made this decision? In case this was not clear, I am only talking to Dr. Antunes here as she is the one who makes these decisions and sends out these emails. I ask you to reconsider and go back to the normal AB schedule so students can keep a sense of routine that we have set up for ourselves. Thank you. Okay. So now going to the Zoom call. Ms. Gordon, I am promoting you to a panelist and I will ask you to turn on your video and unmute you.
There we go. Hi. All right. All right. Hi, I'm Dana Gordon. Live at 4 Dumont Round in Hillsborough, New Jersey. Hold on one second here. It's hard to navigate. There we go. I'd like to thank you for your decision to look at data and choose to have the schools go remote. Today, we had 40 new cases, making our total number of cases over 1,000. Since school has started in September, we've seen 498 new cases in town. In less than 3 months, we've almost doubled what we've had the prior 5.5 months. I hope you don't wait until December 4th to extend remote learning so that parents, teachers, and students can all plan for the coming weeks. Students can be affected by constant changes to their schedules, and it doesn't affect them well. I want to take my remaining minutes to thank a teacher. I'm very blessed with my children's teachers in Team 5A and 8B. They're really stellar teachers. Thank you, 5A and 8B, but I really want to take a trip back to 2013. After a rough experience in kindergarten, we were excited for first grade. My son was blessed with Jennifer Hazel, now Lloyd, as her first grade teacher. She listened to our concerns, she understood and appreciated his out-of-the-box thinking, and she made sure to always advocate for him. She turned our school experience from one that made us feel like our child wasn't being supported to one where our child was excited to be at school. She made school something to look forward to. In 2015, I began substitute teaching for the school district and began to develop a working relationship with her. I saw how excited her students were and how my son was not the only student she put 100% of herself in. She somehow managed to do it for all her students. I'm sorry to see that Jen is leaving the district. It's a real loss. Knowing Jen, I'm sure that this was not an easy decision. I want to make sure to wish Miss Jennifer Lloyd good luck and thank you for everything she's done for our students. Thank you.
Thank you, Ms. Gordon. Mr. Zabelli, I'm going to promote you to panelist and then ask you to turn on your video and unmute. Let's see, where are you? There you are.
You're asking me to unmute?
Mr. Zabelli?
Yes, sorry. Yes, I'm here. Thomas Zabelli, 9 Upper Nishannet Court. So I just wanted to leave a quick comment. Being that the elections are over, I just wanted to first thank the current members of the board who lost in the election. I know it is not easy. Having run for office myself, I know it's not easy to not only lose, but also you're in an environment where you're damned if you do, you're damned if you don't. So thank you for your service, and a special thanks also to Ms. Harris if she's on the call. And again, thanks to all 3 of you. And I just want to also make mention that with the new 3 members coming in come January, I know that they were endorsed by the HEA as well as the NJA's Super PAC Moving Forward, I believe it was called. I received many of their mailers. I hope that they understand the need for independence and the need to not be beholden to what it is that either the local union or the NJEA says. I hope that they understand the need to be impartial and do what they feel is best for the community as a whole and not specific groups one way or the other. So that is my comment, and thank you very much.
Thank you, Mr. Zabelli. Okay, seeing no other hands raised, I will close public comment and open board comment. Does anybody have any comments? Mrs. Stats.
Regarding the change in the schedule, at first I thought, well, this was in the roadback plan that if we were 100% virtual, this is what would happen. But upon further consideration, well, there are other things we changed from the roadback plan, so that's obviously not something that is a good thing to hang the argument on. And also at the beginning in September, even though we were 100% virtual, we did follow the hybrid model in preparation for our students when we are truly hybrid, so that wouldn't be such a, it would, so they could adjust more easily to it. And so we're having them change to the virtual plan next week. And then the following week, I mean, it's possible we could change again if we do go hybrid. So it's almost like a whiplash effect to have all these changes taking place. So that is a concern of mine. And what really made it a compelling argument for me was Dr. Feltry's presentation. It seems like it's what we're doing is really being quite effective. Not what we're doing, what's happening in the schools. So if it ain't broke, don't fix it. And for the sake of everybody, especially our students, I'd like us to consider, or I'd like the administration to consider keeping the hybrid model for the sake of everybody. And even, and also part of that, have the high school start at 8 o'clock instead of 7:30. It's whichever you choose, whether you want to go back to that virtual model or the hybrid model. We can do it. We have been doing, I believe, and having a later start day has been the recommendation by so many experts, and this is an optimal time to implement that. Thank you.
Thank you, Mrs. Stats. I do want to clarify that we were at no time during this school year in a fully virtual environment. We had children in the school starting September 8th. So any other board member comment? Mrs. Trujillo?
I have a question regarding the process for what happens when a student is accused of cheating. And I just wanted to I was just trying to look, is it something that's handled in the high school handbook, or is it, or the 5600 Student Discipline Code of Conduct? If we could just maybe have a little bit of clarification as to what the process is, because as I see in the policy 5600, it only states that a student who has cheated on a test or assignment, plagiarized material, falsified sources, etc., may suffer a reduced grade by virtue of the disqualified work. In no other instance may a student's grade be lowered as a direct penalty for misconduct. And it doesn't, so I'm just wondering, it doesn't specifically say 0. It just said, well, let me see. May suffer a reduced grade. So I guess I'm just wondering how it plays out.
I believe it's a code of conduct violation in the handbook.
All right, so if I pull up the code of conduct.
Mrs. Trujillo, there is a chain of command that it goes through, starts at this teacher level, works its way up through VP, principal, supervisor, assistant superintendent. It's thoroughly investigated and worked through, is typically the way it works.
I guess my question is, so it works through the chain of command, and if the parent is not satisfied, then it comes to the board?
It never comes to the board.
It never comes to the board.
No.
So what is the recourse for a family?
I think she's unfortunately exhausted it. I mean, this is not something that the board takes action on.
Right, so I guess my question is, so it's in the, I can't find the handbook right now. But I guess my question is all right, let me think about that some more and see if I can clarify my question. So I actually have another question if there's no other comments from the board, and it's a question to Mr. Lapira regarding a different topic, which is bylaw 152, Dr. Susan, that I had mentioned to you by email, that if folks remember the January 2020 election earlier this year for board officers was a bit chaotic. And after that meeting, we talked about updating that policy. I don't think it ever got through any committees. And and as January 2021 is coming up, I do think it's important for the board to consider it. I know I missed governance committee's meeting, so I wanted to ask Mr. LaPiero how we might address it.
Well,
I probably need to know the specific issue with 152, but I'm pulling it up as we speak.
It's just a nomination of board officers for voting. And Mrs. Trujillo, after the governance committee meeting last week, had requested that we take it up. I suggested that she send, she said she had a proposal. I suggested that she send the proposal to me and that we schedule a governance committee meeting to review it. At which point, once there was agreement to bring it back, I would bring it to the board at the next meeting. We have 2 remaining meetings with this particular board prior to the new board reconstituting in January. So we can, in fact, have 2 readings prior to that going into effect for January. Was my suggestion, Mr. Pear. Do you have another suggestion?
That's fine. I mean, yeah, absolutely, that can be done that way. And I'm not sure what specific change we would be looking to make, but certainly it's something that can be discussed by the committee, recommended to the whole board. You have it for a first reading. The whole board obviously can discuss it and debate it. And I mean, that's certainly appropriate, because I would say that, yes, each individual Board of Education has its own rules with regard to nominations of officers and things of that nature, but they vary, right? And how they actually get implemented, whether you do it by putting nominations out there and doing the first person gets voted on and so forth and so on. Some places do it where you go around the table and everyone votes for the candidate that they want. And then if you don't have a majority and you have the 2 highest vote getters basically go into a runoff or whatever. So there's different ways of doing it, and that's certainly something that this board can determine.
Right. So the issue, Mr. LaPierre, is after the January meeting earlier this year, you had suggested, because the way our current policy is written, it says that voting shall take place in the order in which the candidates were nominated. So if you recall, there was the mad rush to nominate candidates because the way the policy was written, whoever got to 5 votes majority first, then voting would stop. So the proposal is really just to expand upon the policy and allow all nominations to have a chance to be voted on. The result may end up being the same. That is fine. That's not in question, or that's not the issue. It's more of an issue of decorum and not rushing to be the first to nominate. So that's the purpose of introducing this policy. And I guess I'm just frustrated because we're at the end of the calendar year and we haven't moved on it since January.
So probably one of the, Mr. Trujillo, I can certainly take a look at that, or once you've met with the operations, or is the operations of the governance committee, whichever one it is.
Governance committee.
Governance, excuse me. Yeah, one of the ways to potentially effectuate that goal would be the style in which you have nominations. And let's say that, you have board member A, B, and C, and then you go around the room and instead of saying yes or no, the board members say, I vote for A, and then the next board member votes for B, and maybe you get another vote for A, so forth and so on. And if you get 5 votes for A, then A is your president. And then if you don't get 5 votes and you get something like 4, 4, and 1, now you have to have a runoff between the 2 people who got 4, for example. So that's one way to do it. There are some boards that do it that way. There's a number of ways to do it, but I'm not sure if that was your proposal, Mr. Trujillo, but that's certainly doable.
So I just want to say that we we're going to have a governance committee meeting on several bylaws in the March timeframe, and then the pandemic hit and things shut down, and the administration literally had no time. They were working around the clock. So apologies that we didn't get to everything, but I think this has been a year to forget. And honestly, this has not been on the top of anybody's thoughts. But now that we have a proposal and we can schedule a governance committee meeting in the next couple of weeks prior to the first meeting in December, and then have something adopted before the end of the year. But I don't think it's a good use of anybody's time to jump into this evening and have a 9-member debate about a policy or a bylaw that we might be able to take up with no discussion, everybody just reviewing the proposal on December 9th, I think is our next meeting, if I'm not mistaken. 7th, okay, thank you. Mr. Gillette.
Thank you. So I just wanted to just say something about the same policy. Look, the policy allows for, I'm not sure if Mr. LaPierre is understanding it on the same way I am. The policy allows a board member to vote yes on as many candidates as they choose to. That's a feature of the policy. That's not a defect. All we wanted to do is change the policy to just allow every candidate nominated to be voted upon. So there'd be no rush to nominate somebody first so that candidate can get their 5 votes first. That was disastrous last year. So just a simple change in the policy just to ensure that every candidate nominated will be voted on. Then it doesn't matter what order they're nominated in. There doesn't have to be a rush. We don't have to bring our Jeopardy buzzers in to buzz in. So that's my first comment. My second is, this I guess is directed towards Mr. LaPierre. What if we have no confidence that the governance committee is actually going to take this up and bring it to the next meeting? Because it's been over 10 months and the governance committee has not taken this up. We had this discussion in January and this has never come up. Now we're at the deadline. So we have it here. Ms. Trujillo has worked on something, but it doesn't even need to be worked on. It's just a simple change. So let's play the scenario out. December 7th comes, and the governance committee hasn't looked at it. There's nothing on the agenda about it. Can we just, is it permissible by board, school board law, whatever you want to call it, or for us just to, majority of board members just to vote on changes to a policy right there on the spot?
So you can always propose a policy. I mean, let me go to like the broader perspective, which is there's nothing necessarily that prevents board members from making a motion to do something at a meeting, right? To take a certain course of action. Now, obviously, with policies, you have to, and bylaws, you have to have 2 readings. So so that it certainly can be advanced and it can be approved for a first reading or what have you. So in theory, yes, it could be. Now, I don't know what the comfort level is with everyone. I don't know if everyone has seen it. I can just tell you from my perspective, I haven't. So that doesn't mean that you can't act on it tonight if you so choose, or if a majority of the board wants to do that. But I would need to see that. And I guess, Mr. Gillette, to your point, I understand exactly what you're saying with regard to, we don't want to have people rush in to see who gets nominated first. And I appreciate that and I get that. But one of the things that is going to come up is, there's got to be some way of determining who votes, whose name is going to be put up first at some point when Mr. Mahmood says, okay, it's going to be board, we have nominations for board member A, B, and C, and then you've got to take the vote. If you do it without voting for each member, instead of saying yes or no, if you do it like, okay, we're voting on board member A, if board member A gets 5 votes, you're not going to vote on B and C. It's done.
Well, why not? Because board member B, candidate B, can also get 5 votes. You're allowed to vote.
That's the issue. That's why we
Well,
keep
why,
doing it that way.
why can't you? No, but you're missing the, Mr. LePere, with all due respect. You're missing the feature. It's rare that I say that to you. So,
okay.
You're missing the feature of it. The feature of the policy is to get a consensus candidate. So you want to be able to vote yes on as many candidates as you approve of. So that's a feature.
I understand.
The only flaw in the policy is that not every single candidate is guaranteed to be voted upon, because we've instituted this nutty only, whoever gets to 5 first, then it's all over business.
Right. I think what comes up is that I think there is a case, if I recall correctly, and I'll go back and check because I think I had looked at this probably back in January of 2020 or December of 19. I think there is a case that says that once you have now approved by a majority of the board someone who was put up for nomination of a president, you can't say, well, if someone else gets more votes, then it supersedes that. I mean, I'll take a look. I think there is a case that addresses this. So I totally understand and appreciate the goal that you are trying to accomplish. And I just think that there was, if I recall correctly, this is going back, now almost 11 months now, but I seem to recall reading something saying that we couldn't do that. But you know what? I will definitely verify it, and I'll make sure that we get on that ASAP, frankly, because whether there's a first reading tonight, whether there's a first reading on December 7th, either way, we need to know that answer.
Well, look, in light of your comments you just made, then I support Dr. Swasan's initiative to hold this off for the next meeting, because I would like you to check into it and make sure that we get a correct policy. I'm never against having the attorney give us a legal policy. So I'd be for waiting till the next meeting. But I think I made my point.
Yeah, you certainly did. Yeah, and Dr. Swasan, if you can forward me the proposal, we'll have someone start looking at that tomorrow morning.
I will do that. Thank you, Mr. LePere. Any other? Mrs. Trujillo?
So I found the handbook part, and I guess the question is, there is no recourse. It's just basically if a student is accused of cheating, that's a 0. There's no further recourse. It just ends there at the high school level.
That's basically what I said, right?
Right, but that doesn't seem fair.
Right.
It's really not a board decision, Mrs. Trujillo. We've hired professionals, right? The board's hired professionals to go through the process. They've gone through the process.
Any other board comment?
Different topic.
Sure, Mr. Gillette. Go ahead.
Right. Well, I will say, Ms. Fenimore, I'll go to the same topic for a second. I want to thank you for going through the different levels before coming to the board. I think that was absolutely appropriate, and I'm sorry that you're not getting the satisfaction that you think should be coming to you. But at least you went through the levels, and I appreciate that. I wish more people would do that before coming straight to the board or emailing the board directly before going to the teacher or the principal up the line. I had some questions for Dr. Mandelbaum before, and what I was trying to get at when I was asking those questions was, and I think he said it a few times, but he's very diplomatic, which I appreciate, that the risk having schools open is not at all to students. We also heard the director of the CDC, Mr. Redfield, state this week that schools are safe for kids. We also heard the governor state that. And my point in getting to that is that let's just recognize that it's not closing the schools for these couple of weeks is not a student-centered decision. It's a workplace for our staff decision. And I think that's important. They need to be able to work in a place where they're safe. Other professions, occupations all over the state are able to work from home. I get that, but I still think there was another way to do this. I mean, there's another way to keep maybe the 10% or so of our staff that do not feel safe in schools working virtually while we keep schools open. And it's just too detrimental to the students to have schools closed. We should be moving in the other direction. We should be moving from hybrid 2 days a week to 4 days a week, especially for the youngest kids, especially for the kids that the students that are in special needs classes and the students that have IEPs and other at-risk students of all kinds. So I'm very disappointed that we have not yet come to that solution. I threw out some ideas a month or so ago, and just to be frank about it, at least the elementary school principals at the very beginning of the year, even though they had no authority to do so, they had actually worked out a plan for some of their teachers to work virtually with virtual cohorts. Now, they had no authority to do that, and that presented other legal problems because they couldn't, on their own authority, create legal accommodations. Nor could they create a new position of virtual teacher. That's not within the authority of the elementary school principal. But we, in a very limited way, can create some legal accommodations. Mr. Callahan does that, and it's limited to what the law allows with ADA and everything that he gets into with that, and I appreciate that. But we could certainly, like I said a month ago or so, we could certainly get together and figure out ways to create virtual teaching positions. I know some on the board don't think that the board should be involved with that because we're not allowed to discuss talk with the HEA unless it's negotiations. But if we're talking about recognizing new positions in the contract, virtual teacher, or whatever that's going to entail, that's a negotiation. Absolutely, the board can be involved in something like that. I said back in September, I said, if we don't start moving on opening schools to more kids, it's going to get to Thanksgiving, then Christmas, then, remember I said this? Mrs. Stas remembers. It's going to get to, Martin Luther King Day. It's going to get to Easter. We're going to go the whole year, and the kids are not going to have the school they require. 8 hours a week of school. I know, look, 8 hours a week of in-person, I know it's a full week of school. I understand. But 8 hours a week of in-person for the kids, I know Mrs. Salinger is ready to jump on me, but I get it. They're having school. But I think we've got to agree on something. We've got to agree that in-person school, there's no real substitute for it, unless, we're on, I don't know if they're we're on the Starship Enterprise with the holograms or something. Until we get to the 24th century, in-person school is going to be where it's at. Just to say, so I'm disappointed on this, and I don't know how I can vote on the HR agenda, improve all HR, all kinds of HR stuff. Just normal stuff. We're just going to improve all the HR agenda tonight. When the biggest HR issue that we have, solving this issue of having some teachers work from home so that the rest of our kids could go to school 4 or 5 days a week. We can't solve that, but I'm going to vote on sixth period coverage. Who the hell cares about sixth period coverage? Anyway, I've said my piece. Thank you.
Thank you, Mr. Gillette. Mrs. Stats, and then Mr. Oliver.
Well, obviously in the past, and obviously until now, one of the issues is there are teachers that have wanted to teach virtually for a variety of reasons. But also compounding that is the fact that some staff, including teachers, are, I guess, being forced to work from home. They're being forced to quarantine because of the requirements. Now that we're high risk, correct me if I'm wrong, Dr. Soisson, that if they're contacts of contacts, that adds more people that are then required to quarantine. So that's compounding the problem. And I don't know how we get around that to address your concerns, Mr. Gillette. But I do agree. I wish we could look more into addressing how we do have teachers that would be happy to teach from home, and trying to accommodate that, and while still addressing concerns about equity and fairness and all that. it would be a tough task, but that doesn't make it undoable or just ignoring it. It would be nice for us to continue considering it. So I do agree with you on that.
Thank you, Mrs. Stats. Mr. Oliver.
Well, I have a few comments tonight kind of on that same subject as Mr. Gillette, but just indulge me a little bit. I have my patriotic mask on today, and we're sharing Veterans Day a couple of weeks ago. And fun fact about me is I do a lot of work with PTSD veterans out of the VA hospital in Lyons, New Jersey. And we're trained how to recognize little tells where they're having a tough time. And we teach them the game of golf, or we take them fishing, or we do various things for them. But the tragic thing is that we lose 20 veterans a day to suicide, suffering from PTSD. And we're trained as Americans, as citizens, as patriots, to say thank you to our veterans. We say thank you for your service. Thank you for doing what you do. But they're words. They're words saying thank you. I want to go the next step, and I want to put my money where my mouth is, and I want to do something nice for a veteran. I want to teach him how to play golf. I want to take him fishing. If I see him in Wawa, I might buy him a cup of coffee. And I'm hearing a lot, and I'm hearing nothing about the students. That's why we're here. We're here for the students. And for the first time tonight, I heard a couple of people talk about how this is affecting the students. Mrs. Stats, great. That's awesome. We need to look at this. We need to look at this tonight. If we have 1,200 students signing a petition telling us, you're going to drown us. I'm sitting on the beach and I'm watching these kids out there in the ocean and they're drowning and I can't throw them a lifeline. We're talking about high rates in town. But the governor has said, and many people have said, schools are the safest places. So I was in Cater to Fair Deli on Friday with 2 police officers. They weren't escorting me there, by the way. They were getting lunch as I was. And the text came over that we were going to all virtual because of the high risk. And the one police officer said to the other, great, look at this. You know, we're going to be spending the whole weekend chasing kids. And I said, excuse me, I said, are your children suffering in this, virtual model? They enjoy the hybrid? Not my students, he said. Your kids. I said, excuse me? He says, yeah, we're going to be chasing runaways, drug abuse, loitering, all kinds of problems all weekend long. Because these kids have no outlet. They have nothing to do. They're missing out on social interaction. They're missing out on time with one another. Now, I'm not going to sit here and say I have the perfect solution, because I don't. And I don't think anybody on this committee has the perfect solution. But together, we could come up with the perfect solution. There are teachers that are fearful for their lives. They're fearful for COVID. And I don't dismiss that fear. But there are also teachers that didn't go through all the education and all their lesson planning to sit and teach on this little 7-inch, 10-inch, 14-inch screen. That's not why they got into teaching, and they would be okay with going into the school. If our matrix is high risk, if that's our matrix for opening schools, we're never going to get schools opened again. Because COVID's going to be here for a while, guys. It's going to be here for a while. So I've got a university in downtown Princeton. I don't know what we're going to do with that brick and mortar. Harvard, Cambridge, Stanford. Let's sell the buildings now, because we don't need brick and mortar institutions. I don't hear any language of how we are going to get our children back in school. I'm not hearing that. And that's what I want to hear. We're missing a big piece of the puzzle by not acting on that. Again, our children are suffering. It's not a safety issue. They're not catching it in school. They're safer in school. We need to make our teachers safe. We need to make our teachers comfortable. But there are teachers out there that are comfortable. When I hear from a parent who said, my children are thriving in this virtual world, awesome. I'm so glad to hear that. You have a choice. You don't feel safe sending your child to school. You could go to the virtual world and they could stay in the virtual world. They could be in their home. They could be safe. Where's my choice? Where's the other parent's choice that says, I want my child that interaction? We're not hearing those voices. And quite frankly, that's 40, 50% of the people in the community. They're afraid to speak out. Well, I'm speaking out. I'm tired of it. I'm tired of listening to it. And to Mr. Gillette's points, I don't feel like I want to vote on any item on the agenda tonight because this is the most important and the most critical point that we need to focus on right now. And Mrs. Statson, I don't know protocol, and Dr. Sasson, and I think we should look at a motion for what those 1,200 students have just worked on that position, and I think we should act on that tonight. Thank you.
Any other board comment? Mr. Pulsifer?
Just a point of clarification, I guess. Hearing what Mr. Gillette said about what Mr. Mandelbaum said, that's not what I thought I heard from Dr. Mandelbaum. Was not a question of whether or not our schools are safe or not. I think we've shown that they are. But given the expected number of staff that might have to quarantine based on the contacts, the reason we can't have the schools wouldn't be open is because we don't have enough people to actually staff the schools. Not because it's safe or unsafe, that's a separate question. But if we have to, my understanding of what he was talking about was the fact that given the need to quarantine contacts, you would have quite likely have so much staff being quarantined, you could not staff a school. And I thought that's what he was talking about, that it wasn't a discussion of whether it's safe or not. I think we've shown that our schools have been very safe so far. But if in fact it is a question of quarantining contacts, and we can't have enough staff to safely have the school open from a manpower perspective, person power perspective, then we can't have the schools open. And I would love to get the kids back in school, and we could have the debate about the right kids in different scenarios and who does better or worse. But at the end of the day, if because of quarantine, we don't have enough staff, we don't have a choice about whether or not the schools are open. If we can't staff it, we can't have kids in the school without enough adults in the room to be with them. So I guess the question is, I thought that's what I heard Dr. Mandelbaum saying before, not about whether or not it was safe to be in school, but that quarantining would leave us understaffed. So am I missing something on that aspect?
No, you're not. I know Mrs. Marin wants to make a comment. I have several clarifying things. Mrs. Marin, would you like to go first? Why don't you go ahead? Go first.
Yeah, it's just going to be quick because it's going to reiterate what Chris is saying. Speaking from inside a classroom, because that's where I am currently, since fall break in my district, I have yet to go to any of my duties. I have given up my preps. I have taken care of 3 classes in one room because there is not enough teachers. They're being quarantined. There's just not enough, as you say, manpower, person power. And it's tough. It's really tough. These kids, whether they're in school or home, aren't getting the quality because of these quarantine cases. So that is the reasoning. So whether it's safe to be in school or not, there's nobody to deliver. And it is tough and it is stressful. So thank you, Chris.
Thank you, Mrs. Marin. So I heard a lot of stuff, and I just wanted to, I'm a data person, so what Chris said was absolutely correct. And what Dr. Antunes said in her report was even late the week prior to last week, early the week before, we were on calls with the township. I was asked by the township to join the call. So it was the mayor, Mr. Ferrara, Mr. Delcor, Siobhan Spano, Nick DeLisi. There were, quite a number of people from both sides. I asked Mr. Pulsifer to join as well. And there were no concerns about transmission in the schools. There was no concerns about that. There was a lot of concerns voiced about contact tracing and what happens with an explosion of cases. The township had requested more contact tracers from the county. They did receive some. They actually hired some part-time contact tracers in the last week. Right now, they are inundated with cases. Now, what's happening within our schools? Well, we've had 31, 32 cases. The trend lately has been less students, more staff. Okay. That is, there's no in-school transmission. But immediately upon the start of the second marking period, we saw, originally we had, as Mrs. Haas said, a gain of about 57 students who wanted to come back in hybrid. The first day when the numbers started going high, 90 kids in one day transitioned from hybrid to virtual. So with that, we had about 43% of people in person. That was on day one. We had more trickling out day 2, day 3, day 4 of the marking period. The education committee, as Mrs. Haas said, thought, well, okay, let's really talk about what Mr. Gillette has been proposing, getting the kids who want to be in school more. Look at we asked the administration at the last meeting, we discussed, look at the numbers to see if elementary students can come back, because we know that that's the most stress on parents, as well as that's where we really need, elementary school was never expected to be virtual. Look at high risk or most high risk population who are not currently in school. So people on IEPs, ESS people, ESL people, try to get them back into school. Now that was all before we saw this escalation in case count. Now, when we go to from a moderate to a high activity level, what ends up happening is exactly what Mr. Pulsifer alluded to. Your exclusion criteria for people in the school becomes pretty stringent. And so while the schools are safe for COVID, they become unsafe because of child supervision issues. And then you have more and more kids whose parents are saying, the numbers are getting scary, let's keep you home. It becomes actually negative to put kids on buses. Many of the parents, and especially those who have spoken at the board or sent emails to the board, wanted their kids back in school for a social indications. It becomes less social if there's only one kid in your classroom. And that was happening more frequently. When we talk about, so it's basically a domino effect. You think you're making the right decision for one thing, but as soon as you get into this high activity level, the governor, the CDC, they could say whatever they want. They're talking out both sides of their mouths. They're saying schools are safe, but at the same time, if we have to quarantine half of our staff because of contacts of contacts, I mean, I've been emailing parents who have been asking about this because they haven't really thought through an actual scenario. If Mr. Goodhue has a daughter, I believe you do have a daughter, yes, in the district. You're not actually teaching classes right now, but let's say you were in a classroom. Your daughter comes in contact with somebody who is being tested for COVID. By our last criteria, we would exclude her from coming to school. As soon as we go from moderate, but in a moderate setting, we could trust that you, as a contact of a contact, would be able to come to school, right? As soon as we go from moderate to high, you no longer can come to school. So it becomes almost exponential growth in terms of the numbers of people who are excluded from school. So you're going from 43% of students potentially to 20% of students, and maybe 80% of staff down to 60% of staff. We have no idea how this is going. Now, before we came here, Mrs. Spano sent an email to the people who had been on that call saying that the numbers in town are going up even more, and that the contact tracing that we're doing, that we might need to expand our contact tracers. Right now, it's the school nurses, to even beyond the numbers that we have in order to trace enough to make sure that people are staying out of school in this setting. So, I mean, it was not an easy decision. In fact, being a data-driven person and seeing that we were having no in-school transmission, I was quite supportive of Dr. Antunes' decision to stay in school until such time that you don't have any teachers to teach classes in school. When we talk about setting up virtual classrooms, yes, the principals set this up for what was supposed to be the first 3 weeks of school. Turned out that, the understanding was quite different than what it was supposed to be. But when I asked Mr. Callahan at our last meeting how many teachers requested virtual teaching, he said about 50% of our staff. So there is an equity issue. We could not just set up one classroom in each grade level at each elementary school and think that we are making, we might be making those 10, 20 teachers happy, but we're going to make, 350 people more angry because they were not accommodated. So, I mean, none of this is easy. We're not living in a perfect world. In fact, we're so far from perfect. It's amazing. But, let's talk about the schedule. So one of the things that Dr. Antunes had raised with the Education Committee is if we can't bring kids back to school 4 days a week who need it, maybe we can socially distance them potentially at lunchtime so that we could have full days. In that case, we would be going to a full day virtual environment for those kids who are home because you can do something different for those students. So, I mean, I think, we're all sympathetic to the fact that we don't want to stress our kids out. We don't want to stress our staff out any more than they already are because we know that they are. But let's give it some time to see how people adjust. And with respect to, what happens between noon and 2:30, it was always my understanding that kids were in school until 2:30 anyway, regardless. So they shouldn't have really been doing activities, jobs, and all of those things. Though I understand, I applaud. I worked full time when I was in high school, so I understand, being a highly motivated young person, and I applaud that. But I do think that we have to give education a shot as best we can and trust that our professionals are going to adjust the schedule as needed. I have no doubt that if after a week of this, if we can't come back to school, which I'm very hopeful that people will take the CDC guidance and Dr. Fauci's guidance and everybody, just do Thanksgiving with your people at home or the people you've been quarantining with all along, that we will be able to get back to school. Now, you'll all note that many other school districts closed till January 15th or 19th. That is not what we did. Dr. Antunes, really wanted to make these decisions based on data. And that's what she did. And I applaud her for that because I probably would have had a problem with it any other way. But I think we can all be hypercritical, or we can try to get together and solve some problems. And right now, the one thing that we can do is try to adjust to this new schedule, see what happens, and let our professionals come to us to say, this isn't working. We need to, we need less screen time for the kids. We need to adjust things. In that case, we might want to look at, instead of, keeping the kids on from 7:30 to 12:30, actually using 7:30 to 2:30, but giving them breaks throughout the day to do things, to stretch, to get out. I think, just a thought. But I mean, again, this is not board level decisions. These are why we hire administrators, principals, to discuss these things. And I have every faith that they can do that. So, Mr. Gillette.
Okay, so I appreciate that speech, but none of that is in Dr. Antunes' her email from Friday morning. I heard the word quarantine about, a dozen times tonight. The word quarantine isn't in her email Friday morning. None of this rationalization that I'm hearing now at a board meeting is in the email from Friday morning. Go back and read the email again from Friday morning. None of this is in there.
No, Greg, I did read it, and it says, there is one sentence that says about who can be in our schools or teach in our schools. There is one, she's not.
For what reason? For what reason? We're not because of this quarantining and you may be a contact tracing. None of that's in the email. Okay, this is why the public doesn't take us seriously, because they get one email from Dr. Joyce and a completely different rationalization tonight. And I'm sorry, it's a completely different rationalization. Any other board members agree with me that this is a completely different rationalization tonight than what was in the email? Did you get in that email about anything about quarantines and contact tracing? I didn't get. Yeah, there's a sentence that now you could go back and say, yeah, we can fit that sentence into our new rationalization. Come on.
Greg,
you know what?
Greg, okay, first of all, I spoke at length with Dr. Antonin. You're now calling me a liar, which I do not appreciate. I will read you the sentence that alludes to it, but you know what?
You don't have to allude to anything. Say it straight out. Put the word quarantine. Put the contact tracing language into the letter so people know why we closed the schools.
Because it would have been another 2 paragraphs, but this is where it says it. Let me just find this. A high activity level requires an elevated level of vigilance with regard to who can attend or work in our schools in terms of potential exposure to those infected with the virus.
In terms of exposure, the safety of our staff. That's exactly what my questions to Dr. Mendenbaum were getting at, Mr. Pulsifer. I'm sorry if you thought that we heard things differently. I think we heard things exactly the same. He agreed with me that it was about staff and not about students. I think we all agreed on that. Okay, and that sentence that Dr. Sun, that you just read, I read that as about safety of catching of being infected in school. That's what that sentence is about. That's the plain reading of that sentence. I'm sorry, I'm not an attorney, but that's the plain reading of that sentence.
With who can attend or work in our schools is about not about having to exclude people because of their previous exposure. That is exactly what it says there. I mean, I'm sorry if you didn't understand that. It was not meant to obfuscate. I don't believe. I read this and thought it was pretty clear, but I had also been in the conversations with Dr. Mandelbaum on Thursday night, and with Siobhan Spano on Tuesday. And so, if it was unclear, it was not meant to be unclear or to mislead people. That is exactly the sentence that I am referring to when I respond to people about the contacts of contacts. When you say contacts of contacts to people who don't live and breathe this, like all of us have been doing for, since March, that means nothing to anybody. But that is the sentence that refers to exactly what I'm saying. We're not making anything new up to fit the situation. Any other board member comments? Okay. John, please, Mr. Oliver. John, you're muted.
There we go. And I understand tensions are high, and I appreciate everyone's passion on this because we all have different views and different perspectives. But, I'm going to go back to Mr. Gillette's comments that Mr. Gillette has said repeatedly. We just need to talk about this. We have experts. We have, Mr. Goodhue made mention at our last board meeting that he's willing to sit down in a non-negotiation type atmosphere to come up with solutions to work with helping our teachers feel safe and getting our students back in school. And I'm just frustrated to the point that, again, I'm going to go back to if you're not feeling safe and you don't want to send your child to school, you have that option of virtual. But we're missing a whole segment of the population that does not have that option of getting children into school. And I don't hear anyone talking about how we get our children into the school. So the Flemington, Hunterdon and Central School District came out with, and they've said all along in their restart plan, was if the incidence of high comes, we're going to close schools. We're going to go to virtual. And the incident of high came, and they said, well, we looked at that, and we realized that our children are safer in the schools, so we're going to keep the schools open. We are going to lose a child to drug abuse, to suicide, well before we are going to lose a child to COVID. And again, all I'm asking, and I think Mr. Gillette is asking the same thing, can we sit down with the experts, with the unions, with the teachers, with the leaders in the community, and come up with solutions? Can't we just talk? It's a foregone conclusion in my mind that December 4th is going to come and go, and we're going to be still in this virtual world. Who are we kidding? The incident rate is still going to be high, and we're still going to say we have to be virtual because the incident rate is high. Whether the incident rate is high or not high, let's figure out how we get some of the kids back in school. The town is in desperate need of contact tracers. Can we help them get contact tracing? Can we get volunteers? Can we get lunch aides, bus aides, someone to help us with contact tracing to get us back on the road to recovery, to get this dreaded pandemic behind us for the sake of the students? That's all I'm asking for. I think that's all Mr. Gillette is asking for. We're passionate about it. We're asking for some help.
Any other board comment? Mrs. Stats, then Mr. Pulsifer.
Thank you, Dr. Soisson. I just want to emphasize, I like the idea if we could have more collaboration, including a variety of voices, and also whether or not students are in school or virtual, both situations, students that are in school and virtual, there is an increase, I would think, of mental health issues. So no matter what, I do believe we are addressing that, but I think it wouldn't hurt to also explore ways we can help them even more in that regard, because just the whole pandemic, just the pandemic itself, not to mention all the ancillary effects from it, is creating a lot of stress for them and also staff. So I would like to have us explore ways to help everyone in that regard, no matter what kind of learning environment anyone is engaged in. All of the increases in mental illness would demand that.
Mr. Pulsifer.
Thank you. Yeah, I think we have to be careful that we're trying to come up with a single solution to multiple problems. Certainly, I'm all in favor of finding ways to get either more kids in school or more time for the kids in school. And certainly as we talk about how to address COVID safety within a classroom or within the building, that's one set of problems. But again, I really think we have to separate that from this question of why we're closed right now. Whatever wonderful plan we can come up with, if the numbers work as the way Dr. Mandelbaum was discussing, and as Dr. Soisson was also mentioning, if we end up with contact of contacts giving us some very low percentage of staff allowed to be in a building, no magical plan is going to serve our students, because if they all have to quarantine, there isn't a way to put all these kids in school, regardless of how much those kids want to be in school, regardless of how much teachers want to be in school, regardless of how much those parents want their kids in school. If we have too high a percentage of staff that have to quarantine because of contacts or whatever rules there are around this when we're in a high thing, none of those plans can work. We have to recognize at different times we have different problems to solve. And if we try and sit here tonight and come up with one magical solution for all this, it's not going to happen. We have to recognize that there are different issues on the table, and the primary issue right now is not about COVID safety per se within the schools, but about the fact that if we have to quarantine all these people, there's no magical plan that actually puts enough teachers in a classroom that you could put the students back. So I don't want people to think that we're trying to get, that somehow there's some plan to try and avoid all this, because it's a simple fact. If we have too many teachers quarantined, it's not a safe environment for students because there are not enough adults, not because of COVID. And we can't apply our COVID solutions and problem solving to a non-COVID problem, which is not enough people in the building. We can't magically solve both of those at the same time. We have to recognize what's driving the problems of the different scenarios. We should absolutely work on ways to improve virtual, but you can't improve kids in the classroom that I keep hearing people pushing for if we aren't able to put teachers in the classroom because they're all quarantined. We have to look at all the details. Thank you.
Thanks, Mr. Pulsifer. One other thing that I will say is that before we went up from the moderate to high, Dr. Antunes had sent a survey to parents of our high-risk students who are only in school 2 days a week, asking them about their interest for 4 days a week. There was work happening to try to get more students back in where we could. We need the numbers to go down so that we can ensure appropriate staffing to be able to do that. But, that is the plan. So, okay, it is now 10:15. And we have a long agenda and I think some more discussion along the way. So I would like to move to the action agenda. Let's start with that item on stigma-free Hillsborough, please. So we have a resolution to designate Hillsborough Township Public Schools as stigma-free. Can I have a motion to approve the resolution? Thank you, Mr. Pulsifer.
Second.
Thank you, Mrs. Stats. Any discussion? Okay, seeing none, may I have a roll call, please, Mr. Mahmood?
Surely, Mr. Gillette?
Yes.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Yes.
Mr. Pulsifer?
Yes.
Mrs. Stats?
Yes.
Mr. Trujillo?
Yes.
And Dr. Soussan?
Yes.
Motion passes.
Thank you. Dr. Antunes, can you take us through the action agenda then, please?
We can't hear you.
Lisa.
Okay, let's try again.
Yeah.
The superintendent recommends that the Board of Education approve the education agenda as follows: 9.1 to 9.6. Motion to approve the HIB determination. The revised curriculum is listed. The 2020-2021 nursing services plan. The motion to submit the NJQSAC performance review. Motion to submit the security grant application is listed, and approve policies and regulations for first reading as listed.
Thank you. Can I have a motion to approve items 9.1 to 9.6 on the education agenda?
So moved.
Thank you, Mrs. Haas. Dr. Harris, would you like to second that?
I will second.
Thank you. Roll call, please, Mr. Mahmood. Oh, I'm sorry. Any discussion before? Mrs. Stats.
I'd like to separate 9.4, please.
Okay. Can any discussion on 9.1 through 9.6 with the exception of 9.4? Seeing none, roll call, please, Mr. Mahmood.
Surely, Mr. Gillette?
Oh, well, excuse me. I don't know if I need to separate, but I'm going to vote yes on everything except no on social studies 1, 2, and 3. I think Mr. Torres said we could do that. So yes, except no on social studies 1, 2, and 3.
That's correct. As long as I'm in, Ashley can do that. It's fine.
We're fine with
Yeah, I'm the only difficult one doing stuff like that.
It's okay.
Okay.
Mrs. Haas?
Yeah, yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Yes.
Mr. Pulsifer?
Yes.
Mrs. Stats?
Yes.
Ms. Trujillo?
Yes.
And Dr. Soussan?
Yes.
Motion passes.
Thank you. Can I have a motion for 9.4? The motion to submit the NJQSAC DPR?
So moved.
Thank you, Mrs. Hotz. Second?
Second.
Thank you, Mrs. Maroon. Roll call, any discussion? Nope. Okay, so roll call, please, Mr. Mahmood.
Sure. Mr. Gillette?
Yes.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Yes.
Mr. Pulsifer?
Yes.
Mrs. Stats?
Abstain.
Ms. Trujillo?
Yes.
And Dr. Sassone?
Yes.
Motion passes.
Thank you.
The superintendent recommends that the Board of Education approve the human resources agenda as follows: 10.1 to 10.16. Motion to approve resolution and job description, policies for first reading, retirements and resignations. And I would like to thank Mrs. Freeman, second grade teacher at Woodfern, who's been with us for 21 years, and Mrs. Migliori, teacher of health and phys ed at the high school, who's been with us for 36 years. Thank you very much for your service. Motion to rescind the co-curricular contract and approve the revised co-curricular advisors, to approve the revised 6-period coverage and revised leaves of absences. Motion to approve leaves of absences. Motion to have appointments as listed, as well as appointments of mentors and buddies. Motion to approve the elementary intramural advisors and the HPSA salaries 2020-2021. Motion to approve an administrative internship, approve extra coverage, and to increase the substitute nurse daily rate of pay.
I'm going to separate out 10.16. Do I have a motion to approve 10.1 through 10.15?
Could I suggest that we also withhold 10.2 because I expect there to be significant debate?
Okay. Everything but 10.2 and 10.16. Can I have a motion to approve those?
So moved.
Second.
Thank you, Mr. Pulsifer and Mrs. Maroon. Any discussion on 10.1 through 10.15 with the exclusion of 10.2? Seeing none, roll call, please, Ms. Mahmood.
Mr. Gillette?
Abstain.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Abstain.
Mr. Pulsifer?
Yes.
Mrs. Stats?
Yes.
Trujillo?
Yes.
And Dr. Sassone?
Yes.
Motion passes.
Thank you. May I have a motion? I'll start with the easy one, 10.16.
So moved.
Thank you. Do I have a second?
Second.
Thank you, Mrs. Haas. Any discussion on 10.16? Okay, roll call for that one, Mr. Mahmood.
Mr. Gillette?
Abstain.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Abstain.
Mr. Pulsifer?
Yes.
Mrs. Stats?
Yes.
Ms. Trujillo?
Yes.
Dr. Sassone?
Abstain.
Motion passes.
Thank you. May I have a motion for 10.2, the policies for first reading?
So moved.
Thank you, Mr. Pulsifer. Do I have a second?
Second.
Thank you, Dr. Harris. Comments? Thank you. Yeah, Mrs. Stats, go ahead.
Well, I have concerns about just this existing on the agenda. I think the board has a fragile relationship with a lot of the staff. So just this right here jeopardizes it even further. Especially some of the wording. I mean, just the second paragraph already alludes to the cause for dismissal or tenure charges. That verbiage is very frightening, at least from my point of view. And those are, even though they do allude to disciplinary actions later, those are the only specific ones mentioned. I do want to clarify that in the policies on the district website, it does define teaching staff members as anybody who's certificated. So it's really not just the teachers; it's everyone who's a certificated staff member. But these are just stressful times. I just don't think the timing of this is very good. You know, that just adds more stress for everyone, and not just the matter of free speech. I just think the timing is poor. I don't know. I just think addressing this now is just going to damage our relationship even further with the staff. especially items 2 and 6. You know, they're pretty subjective. Must uphold the district's value of respect for the individual and avoid making defamatory statements, etc. Should not use social networking sites which would be detrimental to the mission and function of the district. Number 8, shall not post updates to their status on any social networking sites during normal working hours, including posting of statements or comments on the social networking sites of others. That sounds like Big Brother to me. I mean, who's going to monitor that? I'm just concerned. And then the paragraph following 9, any publication through any means of electronic communication which is potentially adverse to the operation, morale, or efficiency of the district. I would think this policy itself can further destroy or damage the morale of the staff. And I'm talking about both policies because they have the exact same wording for teaching staff members and support staff members. So I would like us to consider tabling this for another time, and maybe even work on having this policy, work collaboratively on this policy with the people whom it affects. Thank you.
Any other board member comment? Mr. Pulsifer and Mr. Oliver? You're mute.
I was following John's lead on how to talk without demuting. I think we've seen in the last several years how far social media can get out of control. Certainly the political climate in the U.S. has been made worse by social media. So I think, to me, that's all the more reason that we have some form of rules and policy in place. If we need to tweak some of these, certainly, but I think now is the time it is more important that everybody understand what's okay and what's not in an environment where collectively, and I'm not talking about people here or not just Hillsborough, but our society in the U.S. Has run rampant with social media. And if we want to do something to change the tenor of all those conversations, we have to start with laying out some guidance as to what's okay and what's not. And to not have any policy, I think is hiding from the issue at a time when we need to do something to make sure that we don't have bad situations evolve from social media. I think with respect to concerns about, I think it was tenure charges or dismissal, there are things that are listed here that are absolutely grounds for potentially for tenure charges or dismissal, and there are things that absolutely should not happen. That's not to say I believe that they will happen, but if they did, there absolutely should be significant discipline or whatever you want to call it. For example, item number 3, may not disclose any confidential information about the school district, confidential information obtained during the course of his or her employment about any individuals, organizations, students, and their families. Clearly, that is something that if it were to happen, that is a serious violation and should have some serious repercussions. We can't do that if we don't have a policy and don't have guidelines that say, when you do something like this, you are probably facing punishment. Because the first question asked to us will be, when we try to do something, when somebody violates something like that, the first question will be, well, what does your policy say? If our answer to that question is, we don't have a policy, then we're abandoning the responsibility of our job of not making sure that we have policies in place to cover these kind of situations. Thank you.
Thank you, Mr. Pulsifer. Mr. Oliver?
So I'm sharing fun facts tonight about John Oliver. So I sit on 2 other boards. I'm a member of the PGA of America, which has about 28,000 members. I also serve on the foundation board for the local section. And we have a social media policy in place. The bank I currently work has a social media policy in place, and we have to acknowledge that on an annual basis. So making comments on social media is very defaming in a lot of cases, and there needs to be a social media policy in place. So I am supportive of it. And the reason why I digress and tell those stories is there's an elected official, fellow's name was Ted Bishop. He was the president of the PGA of America. They served for a 2-year term. And Ted Bishop was removed from his office as president of the PGA of America, serving 28,000 members, because of defamatory comments he made on Twitter about Ian Poulter, who's a professional golfer, and it had something to do about the Ryder Cup. And he called him a whiny little girl. And when the PGA was standing up for diversity and inclusion in their organizations, it was found to be very defamatory. So we need a social media policy in place, but we have struggled with this and we have kicked it around and have kind of thrown it down the road a little bit, but we can't keep doing that. We need to address it. I wholeheartedly agree with Ms. Stats that there are some things in here that could be construed and we could modify this a little bit, but it is for a first reading. We could take this back at the HR committee. I think we could talk about it a little bit more, but it could be tweaked. It's not perfect. We'll try to make it as perfect as possible, but we do need a social media policy in place, and I am in support of moving this forward.
Thank you, Mr. Oliver. Mrs. Trujillo.
So I agree with much of actually all of what Mrs. Stats said. I have some additional concerns that I voiced in the HR committee. I was against moving this policy forward. My main concern is about selective implementation of the items that are listed, because many of these policy statements, as Mrs. Stats indicated, are subjective and are maybe difficult to enforce and even to identify. So that's the first point. The second point is, as Mr. LaPira had indicated in his recommendation against adopting bylaw 164.6 about public meetings in an emergency, he recommended not adopting bylaws that largely replicated language used in the state regulations. So my concern about this policy is that much of this, what's listed in this specific policy, is already covered in existing policies, specifically 3283, which is electronic communication between teaching staff and students, and 3441, standard of conduct, which I believe Mr. Pulsifer indicated was number 3 on this current policy, which I believe is covered in standard of conduct, also number 3. So I would suggest that perhaps instead of a new, I guess I'm not against the policy per se, but I just think that this is not the right time. I think what Mrs. Stats said, that would damage relationships with the, I guess, fragile relationships. I would consider perhaps updating the 2 policies that I listed that might cover some of these issues in a less, in a more positive manner. Thank you. So I would suggest, I will vote no for this policy, and I hope that my fellow board members will join me.
Mr. Pulsifer.
Sorry. Sorry about that. Just to be clear, there is no overlap between, well, I shouldn't say there's no overlap. 3283 is very specific. It's about between teaching staff and students. It is not about a teacher going and posting something on Facebook, Twitter, or wherever else, because that's not communication with a student, that's communication with the world. So if we want to say, we want to totally change 3283 to be any communication between your teaching staff and anybody who could read it, then fine. But 3283 is very specific about teachers and students. It is not about social media in general and all of the other much more global communications that are not directed one person to another. With respect to not having policies or bylaws that replicate law, many of our policies are exactly that. By Strauss Estimate's suggestion and by something we've always done, is that many of our policies actually say, pursuant to exactly this law, we're going to do this, where we effectively restate the law. So the idea that we wouldn't have a policy that effectively restates the law means we should be throwing out a lot of our policies because they restate the law.
And to add to that, Mr. LaPira was saying specifically about how that particular bylaw was in flux. So why if you are even if you are going to adopt something that is exactly written according to the law, that law has already changed 3 times in the last month. So why would you adopt it at this point in time when there is nothing essential to doing that? We have a resolution that makes that we don't need to do it. The other thing, that I'll point out is that Mr. Goodhue even noted that there is a need for a policy like this, and maybe there's specifics in here that he doesn't like. We're happy to take those and consider those in committee between first and second reading. With regard to the WDEA, which he pointed to, I wondered if Mr. Lapierre wanted to make a comment on that.
Sure, and certainly we can review that. But I mean, the WDEA, among other things, does require that we allow staff members and unions to communicate using the public employers email system and things of that nature. I'm not sure that there's anything in there that I didn't see anything in the policy that would violate the WDEA. But if there's any concerns, or there's a question about whether something is a broad statement might be viewed as violating that, we will certainly review that. I think that, I didn't draft the policy, but Strauss Esme did, but I don't see a major issue with it anywhere, but we can certainly take a look at that. And if there are concerns about some need for clarification, that's easily enough done. So we can, and certainly just like as a matter of fact, if there was an actual portion of that policy that violated a law, then the law would trump that. Of course, there are situations in which the law gives you discretion, and some situations even when you have to negotiate that. But generally speaking, if there was something in there that was incorrect, then it would be trumped by the law. But we don't want to put something in, obviously, that would be on its face violating the WDEA or anything else. So we can certainly review it. I would encourage Mr. Goodhue to communicate with Dr. Antunes, and I'll certainly look at it. We do not obviously want a policy that would be unenforceable or illegal.
Thank you. Mr. Gillette and then Mr. Pulsifer?
Yes, so I echo Mrs. Trujillo's comments about, I think what she's trying to say was possibility for selective enforcement on these, and it has to do with how you view the world on a lot of these things. And we've seen school districts around the country with social network policies that view tepid political speech as violating of the policy because they are on the wrong side of a political debate. And we've seen teachers across the country, get suspended or lose their jobs, and at high schools, colleges, because they're on the wrong side of a political debate. And I just can't see us doing that, because that's what it would be here. This is becoming overwhelming now. That's what it's going to be. There's going to be selective enforcement, and I don't know who's going to be the big brother who's going to decide, that I think there's, I guess I can pull it up about respect for the individual. What if you said something like, if you're a staff member in your own personal life, you make a post on Twitter, whatever, social network, whatever they are, and say, I think we should have a better, a stricter immigration policy on the southern border. Is this now going to violate number 2? Because you didn't respect value the individual? We see how things get twisted down the line. So it's garbage, and there shouldn't be any policies like this. Let the Supreme Court decide the limits on free speech, not us here in Hillsborough like this. I'm voting no.
Mr. Pulsifer?
Yeah, sorry, I meant to mention before, I think that, there is actually and I'm not sure certainly Mr. Lapira can weigh on this, but there is a one of the in one of the sections actually specifically states that you can use email and such if it's part of an official act. So I would think maybe a loose interpretation on my part, but I think the WDEA activities that are covered there would be an official part of your job, I guess, per se. So this doesn't actually exclude that, although the language could probably be more specific to that. But I think that we've touched on those areas, and I think we could fine tune that. I think the idea that look, whenever plenty of our policies have a gray area where somebody may or may not have crossed a line. I don't think saying we shouldn't have a policy because we don't know how to handle the gray areas is a good idea. We need to have guidance here so that people can understand what's right and what's wrong. And yes, there may be cases where it is kind of gray, but that's not something that we should use as a reason not to have a policy. That's a reason to have a policy and work really hard to handle it correctly. We shouldn't be running away from it because we're afraid it'll get used wrong. We should be working very hard to make sure it gets used correctly. If we want to address these problems, it takes action, not stepping away from it.
Thank you. I actually agree with you, Mr. Pulsifer. So with that, I think we have a motion and a second. We'll vote.
Sure. Mr. Gillette?
So on the policies, I'm going to vote. Well, I mean, look, we didn't divide them all out correctly. So I'm going to vote yes on 1620 and 8420 and no on 3282 and 4282. Is that what we're doing?
Yes, that's what we're doing.
Okay, so so that's my convoluted vote.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
I'm yes, with the caveat on the social media policy. We work to make a couple of revisions to satisfy.
Thank you. Mr. Pulsifer?
Yes.
Mrs. Stats?
No on 3282 and 4282, and yes on the others.
Thank you. Ms. Trujillo?
Same as Mrs. Stats, no on 3282 and no on 4282 and yes on 1620 and yes on 8420.
Thank you. Dr. Soussan?
Yes.
Motion passes.
Thank you. Okay, next is the operations agenda. Dr. Antunes?
The superintendent recommends that the Board of Education approve the operations agenda as follows: 11.1 to 11.6, a motion to approve the monthly financials and monthly bills, the policies and regulations for first reading as listed, settlement agreement as outlined, motion to accept the donations, and motion to approve revised resolution to amend the meeting procedures.
Can I have a motion on the operations agenda, items 11.1 through 11.6?
So moved.
Thank you, Mr. Gillette. Do I have a second? Thank you, Dr. Harris. Any discussion?
I like to separate, I'm sorry. You didn't call me by name.
That's okay, Mrs. Stats. You can
I guess I'm in a rush.
You jumped in front of Mr. Gillette, but that's okay.
No, I think we're gonna have the same.
Okay. I like to separate 11.3.
Oh, maybe not the whole thing.
Well, actually, just bylaw 0169.02.
Okay, so we're separating bylaw 169.02. Is that what you wanted, Mr. Gillette? Okay, so everything 11.1 to 11.6 with the exception of bylaw 0.169.02. Do I have a motion and a second on those? Or I had a motion and a second on those, yes?
Yes.
Okay, thank you. So roll call then, Mr. Oh, any discussion on anything but 0169? Seeing none, go ahead, Mr. Mahoney. Thank you.
Mr. Gillette?
Yes.
Mrs. Haas?
I have a quick question. Who's been looking at the bills?
Silence.
Should I answer? I reviewed the online, and if I have any questions, I contact Mr. Mahmood, but I haven't been going down into the office.
Well, we all look at it online. The point is to look at the vouchers. No?
Well, correct, and there hasn't been any necessity thus far to look at the vouchers. I don't always look at every voucher.
I wasn't suggesting that you do, but
Okay, all right.
responsibility, and somebody should.
We're
Anyway, yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Yes.
Yes.
Mrs. Stats?
Yes.
Mr. Hio?
Yes.
And Dr. Sassone?
Yes.
Motion passes.
Thank you. Do I have a motion for bylaw 0169.02?
So moved.
Thank you, Mrs. Stats. Do I have a second?
Second.
Dr. Harris or Mr. Pulsifer?
Dr. Harris.
Okay. Discussion on 0169.02, Mrs. Stats.
Okay, this is board member use of social networks. I just wanted to amend item 6 about board members will not respond to any postings regarding Board of Education or school district business on any social, et cetera, on social network. And shall refer any such questions or inquiries to the superintendent of schools to address as appropriate. I'd like to maybe add in, unless the superintendent has designated a board member to do so, because when we had the March 2019 referendum, through the communications committee, we decided that a board member could respond or post comments on, Facebook in particular, but I guess social media in general, when someone especially would misstate something. And it was done just factually, either stating a fact and or accompany it with a link to the website with facts and corroboration to disabuse someone of something that they had misstated, or even to answer somebody's question on social media. So I just wanted to maybe add in there some sort of addition of, or the superintendent could appoint someone from the board. Otherwise, there are some, if we always referred questions to the superintendent, my goodness, Dr. Antunes, I don't think you have enough spare time to do that, right? And it's granted, there are a lot of things on social media we should ignore, but I think there is some value to address some erroneous posts that can grow exponentially on social media.
Mr. Pulsifer?
I understand the sentiment, Mrs. Thatch, but I think that would be a very bad thing to add. With all due respect to Dr. Antunes, at no point does the board get permission from the superintendent to take action as a board member. That either comes from the president of the board, or board members are allowed to make statements certainly with caveats, but it should not be our policy or bylaw that board members need permission or appointment from the superintendent. The hierarchy of the district works in the other direction, and we should not have that included anywhere, that the superintendent gets to appoint board members to a task. That is not within the superintendent's purview.
Mrs. Stats.
Well, then how about we have the board president be that person, or appoint such a person?
Board president is that person.
Yeah.
Or appoint such a person.
Or her designee. Where are we?
Number 6, item 6 of the bylaw.
You could bring it back to committee and then discuss it.
Yeah.
Well, I mean, why don't we pass it for first reading and then look to add something like that? I mean, I think not respond to any postings regarding Board of Ed. Respond to any postings. So we would want to say something back, unless
you could discuss it in committee.
Yeah, I think that makes better sense, because I would like to get Mr. Lapira's input about how best to say what you're saying. Mrs. Stats, I don't have an objection to it. I'm just saying that I think it would be best to not hash that out here.
Well, then I have a question. Since I don't want it as it is written per se, should I vote no? Or you're saying you're going to vote yes, but you're going to address it in committee?
we'll address it. I don't think anybody has an objection to it. I haven't heard one unless Mr. Gillette's raising his hand to object to it. So
I'm objecting to the whole thing, but I have another point to make.
okay. You can abstain. I think we'll have enough votes to get it through first reading if you'd like, or vote no, Mrs. Stats. I think that's fine. That's your prerogative. But trust that we will, if we're having a governance committee meeting on a 152, if that's the bylaw, then we certainly can take this up at the same time and address your concern favorably. If you have specific wording, I think you sent that in an email to me. So if we just tweak that, I think that'll be fine. Mr. Gillette?
Yeah, so same as I did for the other policy goes to this also, but there's a couple of other things. Look, we already have this School Ethics Act. We already have possibility of removal by the voters if they don't like how we're behaving. And this is about behavior, I think. Also, look, I've run for the school board 5 times. I don't think I should be limited to engaging with my constituents during 6 weeks every 3 years, or whenever time I'm active with putting my views out there when I'm running for the school board. That's hypocritical and it makes no sense. If I could do it 6 weeks or 8 weeks or whatever time I do it, every 3 years, I could do it the other. Now I have to do math. 144 weeks or whatever it is, or the rest of those 3 years. It makes absolutely no sense, because are you going to ban campaigning and speaking and the ability of a board member while they're running for re-election to engage with constituents, to make a website or whatever we do and put statements out there and our thoughts on things? Look, I've always gone by the sort of philosophy that you say it first at a board meeting, so there's no surprises, and you can reiterate that as many times as you want on any social medias you want, wherever you want, because you've already said it at a board meeting. These are your views as a board member, and you should be able to engage with your constituents at any time. I think this is absurd that we have this policy has been kicking around for years. This policy was around this exact same when I was board president. That's over three and a half years ago, and it never got through a committee anywhere because for just the reasons I'm talking about. So I just don't see any use for it, and I think it's hypocritical and not rational. It makes no sense.
Mrs. Trujillo?
Well, I agree with Mr. Gillette, and I also think that a lot of this policy is also covered in other policies, such as number 150, which is the standard of conduct for board members, and then number 146. I think it's contradictory because board member authority, it says public expression, board members may express themselves publicly on any matter. So when I read this policy and the second paragraph, when it talks about social networks, what about LinkedIn? What about for our jobs? Like, isn't LinkedIn considered a social network also? What if we have a blog?
I think you're missing the point that this is as a board member. So I cannot go on to a site and say, I'm president of the Hillsborough Board of Education, and here's what I think in that capacity. I mean, so I find it interesting that you're not supporting this when we talked about, you're the one who told us we should bring this up if we're bringing up
because I said it was hypocritical for us to bring up the one about staff members, but not also bring up the one about board members, which I was against both of them.
Okay, well, in any event, I don't see that this is anything different than the way that we should be. This doesn't say that we can't post personal statements. It doesn't say that we can't engage with our constituents. We just cannot express that as the view of the board. And so I don't have any objection to this, but I understand other people do. That's your prerogative and you can vote no. Any other, Mr. Pulsifer?
Yeah, I know that we struggle with this, whether it's for the board or for teaching staff or support staff or whoever we put this out there for. I think the reason we need this is because social media has created so many different ways of communicating, for good or for bad, that we didn't think of I know, Greg, you say this policy's been around forever, but 10 years ago, we didn't think about what would happen on Facebook and Twitter if people tried to use that to sway elections and drive political agendas. We never would even have thought of that. And social media, for good, bad, or otherwise, has carved out a whole different arena of communication. And I think it's imperative that we actually think about things that might be acceptable elsewhere aren't acceptable in social media. If you are having a barbecue in your neighborhood and you're having a conversation with one of your neighbors, you're certainly free to express any thoughts you want. To go on Twitter with a Twitter bio that says you're a Board of Education member and espouse those same personal opinions may not be okay. And that's why, to me, it's important we have this, because social media is different than a lot of the other situations where you might have this question of what can I say and what can I not, because social media is global. And I think that changes the arena that we're talking about. And I think that's why it's important that we have a policy, because this is something, again, we never would have thought of this 10 years ago. But it's here now, and we need to be aware of it and think about it and be doing something about it.
Okay. I don't see any other comments, so can I have a roll call, please, Mr. Mahmood?
Really, Mr. Gillette?
No.
Mrs. Haas?
Yes.
Dr. Harris?
Yes.
Mrs. Maroon?
Yes.
Mr. Oliver?
Yes.
Mr. Pulsifer?
Yes.
Mrs. Stats?
No.
Ms. Trujillo?
No.
And Dr. Susan?
Yes.
Motion passes.
Thank you. Okay, we have informational items as listed, and we have comments from the board and public, and I note that we only have 5 more minutes, so let's see if we have enough to fill that time, or if we need a motion to extend the meeting. Are there, Mr. Goodhue and Mrs. So from that standpoint, before we even make a comment, I think we need to extend the meeting, so if you can just give us a minute to do so. Do I have a motion to extend the meeting by 10 minutes?
So moved.
Thank you, Mr. Pulsifer.
Second.
Thank you, Mrs. Maroon. Do we need a roll call for that, or can we do it all in favor?
Aye.
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 Anybody opposed? Anybody abstaining? Okay. Whichever one of you would like to go first, let me know and you'll go first. I'm promoting you to panelist, and then whenever you do show up here, my computer's being very funny about this, so I apologize. There you are. Good. I'm asking you to start your video, and you're unmuted. Okay, go ahead.
Good, can you hear it? Okay. Amy Salinger, teacher at Ottenwood Intermediate School, HEA treasurer. These are unprepared remarks. So, I just wanted to speak, I'm going to say on behalf of all teachers, because of the ones I've talked to, I don't think anyone will disagree with what I'm about to say. I hear a lot of talk on the board about what about the students, what about the students, what about the students? And I want to make it very clear that every teacher, every staff member, every day does nothing but think about our students. We want nothing more than to have all of them back in our classrooms every day, because that's the only way to do any kind of best practice in teaching. Hybrid teaching, it's not best practice. I can't do for my in-person students and my online students effectively as I would like. Even when they're in school, it's not the same as like normal in school. It's just not. So when we talk about, thinking that the students morning, noon, and night, that's all we do when it comes to our job these days. You hear us talking about our own personal concerns and safety, because those things matter too. But the students are never far from our minds at all. That's all we're doing every day, is trying to make it the best situation possible for our students. Any one of you are welcome to come into my classroom or join one of our Zooms and see our Google Meets and see how it's going. But I just want to make that clear. And when we talk about bringing more students in, which believe me, I want every single one of my students in my classroom every day. That's the way I can teach best. It's not happening right now. And when we talk about gradually increasing it, I think we need to also consider the social distancing ramifications of that, because if we start bringing more students in, 6 feet isn't going to happen. And then if there is a case, that's more contact tracing, that's more quarantining, because you're more likely to be within that 6 feet for the 10 minutes or 15 minutes or whatever. And I think if we're going to start talking about a plan like that, we need to think about those factors as well. And when it comes to some of the other policies that were discussed tonight, the social media, there was another one, I can't remember, but just like I said at the last meeting, and Mr. Goodhue, please collaborate with us. Please bring us on for input. That doesn't mean we get what we want. It doesn't mean we say we want this and you say okay. It just means we have a conversation, and I would love to see more of that happening. That's all. Thank you.
Thanks, Mrs. Salinger. Mr. Goodhue?
Try that.
Oh, sorry. Too much to do. Okay. There you are.
Thank you. Henry Goodhue, Hillsborough Education Association. I just wanted to offer a few clarifying points. There was conversation related to the schedule and about trusting the experts on this. I can say that I have universally heard from the experts that I proudly call my members that for the foreseeable future, they would like to maintain the schedule that's in place. And I think we also heard from, 1,200, 1,300 students and community members who feel the same. So while I understand seeing what happens, I think that our members know what's going on. Our members know what the students need right now. So I think that a great deal of credence should be given to what they're saying about maintaining this schedule, both for the professional reasons, but also for the mental health reasons of our students. So again, I urge you to continue with that schedule, at least until we reassess where we're at with this. I would also like to offer a clarifier on the WDEA. There seems to be a hyper focus on one part of it, which is the electronic communication aspect of it, which was actually not my point. I don't have concerns about my access to the internet, to the district server. I know that if I needed to use that, I am within my rights to do so. I have not been blocked from doing so. Where I do have concerns related to the social media policy specifically is that the WDEA expressly prohibits retribution against a member for expressing their membership and for sharing the opinions of the association. So were a member to partake in something on social media that is a position of the membership, or they're expressing their opinion as a member on a topic, there are pieces of this policy that could possibly be misconstrued that would run contrary to that law. So I am concerned about that. The other piece that I would also offer a note of caution on with this policy is that you're actually undermining your own educational goals. This district has invested a great deal in technology, and many staff members have risen to that and embraced technology. We've had staff members that have won awards, whether that be County Teacher of the Year, State Teacher of the Year, whatever it is, County ESP of the Year, or other awards. And part of winning those awards is maintaining a social media presence. Under the policy that you just passed for first reading, that staff member will now have to get administrative permission to post every single one of those tweets. So we're actually hamstringing some of the very great work that our people do with this very policy and undermining what they do. Staff members have also been commended and reached highly effective in evaluations for their use of Twitter, of social media, to communicate with students or celebrate things that they do. So we're also undermining that aspect of it. So again, while we talked about sometimes the governors going out both sides of the mouth, this policy goes outside both sides of their mouth. Because while we want people to do certain things and we've celebrated it, we're now saying that we could possibly punish you for doing so without having the proper permission to do so. The other piece that I would like to offer is, there was a conversation about, we couldn't see this 10 years ago. But in fact, on February, I believe it was February 22nd, 2010, which was almost 10 years ago, you did see this because you passed policy 3281, which is inappropriate staff conduct that says Therefore, school staff members are advised to be concerned with such conduct which may include but is not limited to communications and or publications using emails, text messaging, social media networking sites, or any other medium that is directed and or available to pupils or for public display. So by your own policy passed 10 years ago, you have already addressed this, and you have not addressed, you didn't do so in this overarching, overreaching way that echoes Orwellian notes of Big Brother and actually undermines your own educational goals and possibly runs contrary to laws that currently exist. And then you actually revised and adopted the policy again in May. So I'm good. Thank you.
Thank you. Okay. Any board comment? Okay, seeing none, can I have a motion to adjourn? Nobody wants to adjourn?
So moved.
Thank you. So I think Mrs. Stats was motioned and Mrs. Haas seconded. All in favor?
Aye.
Aye. Okay, see you on December 7th.
Stay well, everyone.